Good afternoon. My name is Sarah. I serve as the board administrator for the Texas State Board of Examiners of Marriage and Family Therapists. We'll begin with a roll call. Dr. Merchant.
Present.
Dr. Barty.
Present.
Dr. Elder.
Present.
Ms. Azell.
Present.
Mr. Hampton.
Present.
Mr. Parrish.
Present.
Ms. Rania.
Here.
Ms. Richardson.
Present.
And we have a vacant position, so that is a quorum.
Hey, welcome everybody to the Texas State Board of Examiners of Marriage and Family Therapists meeting. It is 1:04 and I call this meeting to order. Oh my God, sorry.
I wasn't expecting.
Maybe a little loud. I'm used to being in the big room.
Here you
Anyway,
go.
I have to say though, I think I like this little room a whole lot better. I like to notice you guys, so. Anyways, okay, well, welcome everybody. I do want to announce that we will have 2 new board members joining us at our next board meeting. William Price will be our new public member to replace Mr. Parrish. And then James Castro, he is an LPCS, LMFT, and he is going to be filling the vacancy left by Mrs. Smith. And so they will be joining us at our next board meeting. So welcome to them. I believe that they might be joining via Zoom today. So, we are still waiting on appointments in the Senate, which hopefully will be happening sometime later this month. But I think that's all I have for our welcome and announcements. Anybody else have anything that they want to say or any other announcements at this junction? Okay, then let's move on to public comment.
For members of the public wishing to give comment, please we don't have anyone here in the room. Please use the raised hand feature on the computer if anyone has joined by telephone. After all of those who have raised their hand on the computer have had an opportunity to speak, I will call on those who have attended by telephone. Generally, for public comment, please identify yourself and whether you are speaking individually on behalf of an organization. All public comments will be limited to 3 minutes unless otherwise directed by the presiding officer. Those of you who are attending for a licensing appeal, we will take that at another time, not at this public comment period. So you'll have an opportunity to address the board when we discuss your appeal. And please refrain from discussing any private information regarding an appeal process or a complaint process. And with that, we will look at the attendees. I see no hands raised for public comment. And the raised hand feature is at the bottom of your navigation bar if you're attending via Zoom. I see no one attending by telephone. So I believe that ends public comment.
Thank you. We might try.
Oh, we have a raised hand.
Oh, we do. Okay. I was gonna say we can open it up later if we need to.
Ms. Martin, you have public comment?
Yes, sorry to be late and catch you on the go. Just wanted to give you a brief greeting. I'm Sandra Martin. I'm an LPC approved supervisor, and I'm speaking in this meeting for Christian Counselors of Texas. We're trying to expand our reach into government. In the last couple of years, we've addressed mostly BHEC itself, and then, of course, the LPC board. That was as much as we could manage responsibly in that time. But we really want to expand our reach into all the boards as well as BHEC. And so you'll find that our public comments are typically much less than the 3 minutes typically allowed. We find also that the LMFT board, I don't know if you'll like this or not, but it seems to be the board that has the least amount of trouble. I don't know how you explain that, but you must have an explanation for it. We like it. So I look forward to meeting with you more, as well as with the other boards than those we have met with. I'm sure that we'll find much to learn about you and how you function and what's important to you. And so we welcome you I hope you welcome us. Thank you so much.
Thank you, Ms. Martin.
May I comment? Okay. Well, thank you, Ms. Martin. We are glad to have professional associations present. We enjoy hearing from our professional associations and from members. So thank you for being present, and we look forward to further engagement with you.
Seeing no other hands raised and no one attending by telephone, I believe that ends public comment.
Thank you. We might also do we've done it before, we've done it at the beginning and end, so we might do it again later. I'm sorry, I need to go back to agenda item number 1, because I forgot approval of the minutes from the previous meeting. So, I trust that everybody had a chance to skim through those. May I have a motion?
I'll make the motion. Accept the minutes.
Okay, do I have a second? I'll second. Okay, all those, or any further discussion? All those in favor of accepting the minutes, raise your hand. That is unanimous, so it passes. Okay, then we will move on to agenda item number 4, which is just reports on general matters. So I'm up first with a report from the board chair, and I'm sorry, guys, I have a lot to talk about today. First, I just want to say that Sarah, Nicole, and I, we all 3 presented at the Texas Association of Marriage and Family Therapists Conference back in February. And it went really well. We had probably at least, I don't know, 70 people in attendance, you would think. I don't know. I feel like the presentations went really well. We had 2 hours. We just kind of did like a rule review, and then we did like most common violations. And we had just lots of really good discussion. Afterwards, somebody who was present reached out to me and asked me if it had been recorded so they could make their licensees, like their associates, watch, the presentation. I told them no, and so they reached out to TMFT and then basically said, "Can you please have Lisa come do one that's recorded so that way it's preserved." So in September, I'm going to be doing a presentation for TMFT just on common rule violations. So I'm excited about that. Jody is going to be presenting at TCA in November, the Texas Counseling Association. She does a similar presentation just on rule changes. Jody, do you do common violations also, or do you just do rule changes?
I do rule updates, but I also include common violations, and I cover telehealth and coaching. I kind of throw that in because I think those are important ethical considerations as of late.
Yeah, cool. And is that like an hour presentation or an hour and a half?
It's an hour and a half, and Dr. Barty has typically joined me in that. I was curious if anybody wanted to join me. I haven't submitted the program proposal yet.
Is it in Dallas this year, or where is it at?
Let me look. I believe, unfortunately, Houston.
Watch it.
It's just a long drive.
When is it?
Okay, so the dates are different this year. It is going to be the 20th, so November. I'm looking at November, and the presentation is typically either Thursday or Friday. We've traditionally been on Friday, so the conference opens Wednesday night and ends on Friday afternoon, the 21st.
You and I could talk offline. I might be able to do that with you, maybe.
That'd be great. I'd love it.
Cool. Okay.
Russ, are you interested again?
Oh, sure.
Twist my arm.
Well,
Okay.
all 3 of us. It'll be fun.
Yeah. Okay, great. I'll email y'all and then we can put together a proposal. I need your credentials and stuff. Thanks.
Up next, and again, we might need to save this for the end of the meeting, but I want to mention it now because otherwise I'll forget. I'm thinking about maybe canceling or seeing if y'all are open to maybe canceling the July board meeting. Normally this meeting is in April, so there's a little bit more time for board business to happen between the April meeting and the July meeting. But given that it's May and our next board meeting is 2 months from now, there's not going to be a whole lot of time for work to happen in committees. There's not, if any rules that we approve today might go to BHEC, but they're not going to have time to go to public comment and to get those back to us. And so I'm thinking about maybe seeing how y'all would feel about foregoing the July meeting and just meeting in September. Any objections to that?
That'll work.
Okay, good. Okay, well then-
Staff are quite okay with that.
Dr.
Okay,
Merchant,
then, yes,
my only question is, would that hold up anything as far as resolution of application or resolution of ethics issues? I don't want to make applicants wait.
do y'all have any that you could foresee bringing to the board in July, or that could not be handled in committee?
We only have one right now, and that's from January to now. There's one on the agenda, so.
For July?
No, not
I-
today's.
So I
Okay.
just mean on today's agenda, we've had from January until now,
Okay,
and there's only been one application we need to bring to you.
okay,
So odds are there would not be any applications we need to bring to you. And if so, maybe one. And
Perfect.
So
okay, well then, do we need to vote on that, or can we just decide?
I think you can just instruct.
Okay, I instruct,
Yeah.
I so instruct that we will not have, the July board meeting.
You wanna get the.
It is decided. Also, I was gonna ask, Jody, in the past, attending the January board meeting has been difficult because that's often been your first day of teaching. Last year, you had reached out to SMU to see if they were interested in hosting. I'm curious if you think, do we need to consider a plan like that for January?
That would be great because it is again on the first day that I teach class in the spring semester. So I can ask them, like, and maybe if we get it on the agenda or the schedule way early, yeah, let me follow up on that. Thank you for that idea.
Okay, cool. Okay. Next, I do have just some legislative updates. If y'all, I don't know if y'all know this or not, but SB 14 was signed by the governor. This creates a Texas Regulatory Efficiency Office, which will could potentially have an effect on rules, how rules get passed, how rules get created and passed. Basically, their goal or their job of this office is to just kind of ensure efficiency of regulation, making sure there's not excessive paperwork that licensees have to fill out, or excessive forms, things like that. I don't think we have any idea exactly how this is gonna play out, but I did want to let you all know that that did pass, and so that could have implications for how we do things. Do anybody want to add anything to that?
it's a big question mark right now, and the only thing I'd add is odds are it's gonna be a lot more focused on the really big agencies.
How does our agency compare to other agencies in terms of like size?
Small.
We're
Small, yeah, I mean, there are plenty of small agencies that have 9, 10, 20 employees, we have 60. But the big agencies have thousands
Okay.
of employees, so.
We also, House Bill 1716, also, has moved from, the House to the Senate. That is a bill that would allow, LPC associates and LMFT associates to bill Medicaid. Do we have any kind of update on that bill at all? Do y'all know, or is it just, when I looked this morning, it seems like right now it's in the Senate and that's just where it's at.
Yeah, that is where it's at, but that is a good sign.
Yeah.
That it made it from the House to the Senate.
Yeah, for sure. Other bills that we have been kind of tracking, Senate Bill 51, which was kind of the bill that would have maybe clarified some language in like our statute, the LPC compact, there's a universal licensing bill that was up. There's a telehealth bill that was presented as well. It's my understanding that those have gone absolutely nowhere and are not expected to go anywhere. So maybe it's just some updates on that. Are there any other like legislative issues that y'all have been tracking that you think we should know about?
There were a few tele-service bills that did go through, but they all generally involve practice of medicine, and your licensees are carved out already, so it won't impact y'all. There's a lot of Public Information Act bills and Open Meetings Act bills that won't impact y'all directly. The Medicaid coverage would be the biggest, I think, change for licensees.
Yeah, thank you. Amazing. So, okay. Any questions from you guys about any legislative issues? Okay. One of the other things that I would really like to do this summer, is I would actually like to get around and visit all of y'all, have coffee or lunch or go to the zoo, I don't know, like just do something. Just because basically I just kind of want to know like how your time on the board is going so far. Like, are you enjoying the work you're doing? Do you feel like we're using your talents and abilities? Like, are there things that you would prefer to be doing? And just to kind of get to know you all a little bit better. So I will probably send out either emails or I might have Sarah help me with that. But essentially my goal is over the summer, when I'm kind of in everybody's neck of the woods, is to reach out and see if we can kind of connect. And I will bring you Oreo cheesecakes. So, anyways, yeah. So just be on the lookout for trying to coordinate some of that. I'll actually be in Houston in mid-June, so you might be the first on my list.
Okay.
So anyways.
Dr.
Yes.
Merchant, one other legislative update I just thought y'all might find interesting, providers might find interesting. There is a bill that has moved from the House and has made it to the Senate that would have a study on the use of psychedelic therapies.
Oh, interesting.
So it's not expanding the use or changing anything, but it has bubbled its way up to become studied of what possibilities that holds.
And so basically, would somebody be doing like a request for proposals for universities or researchers to research that, or?
I've not delved into the specifics. I think they've named a couple of universities, Baylor College of Medicine and Dell Medical,
Okay,
that I think would do the study.
very cool. Okay, interesting. Okay. Okay, the next thing that I want to move on to is, and we're gonna get into this a little bit more later on, but Robert, Sarah, and I have been working on two different surveys, one for supervisors, one for supervisees, and we'll talk a bit more about the mechanics of that later, but I do just kind of want to explain that some of that comes just from complaints that we have heard either through the board or just being out in the community about two things. One is exploitation of supervisees. And then the second thing is sometimes supervisors not feeling like they are empowered enough to be able to gatekeep. And so that's kind of the impetus of kind of these two surveys that we're considering doing. This recently, so several years ago, I heard of somebody who was a supervisor, who was, for his pay scale, he had a 50-50 split with his associates where he was taking half their income. And I thought, man, that's crazy. And I thought, that's gonna be, nobody else does that. Well, I know of at least 2 or 3 other people, even just in the last couple of months, it has come to my attention that there are employers that are taking 50% of an associate's. More than that, you've heard more than, I just can't fathom, like,
It's typically closer to 60.
For 60-40.
really?
That's the industry standard. If you look online, it is far more common that you'll find a 60-40 split or a 70-30 split than 50-50.
Okay, but wait, where the employer is taking 60 or 70?
Yes.
Because they provide the overhead, they provide all
And the
the
clients and the
things and
space.
stuff, and so.
Electronic health record
That's-
system.
Okay, but there's no way, whenever we had this, when this first came to my attention, the associate who approached me said that the employer had promised her that her take home would be $50,000 a year. Which basically means that basically his plan was that she would make $100,000 and he would get 50 and she would get 50. And I just can't imagine there's any number, like the electronic health record, the clients, the training, that does not add up to $50,000 a year. So, I don't know. I guess I'm curious, what kind of, are there even potential remedies? Are there potential remedies to this, to stop kind of this exploitation of associates? Would even be doing something like, requiring the employer or the supervisor to provide a breakdown of this is what this money goes to. Here's the profit, this is what goes to the rent, this is what goes to this. Does that make sense? This is what goes to the electronic health record.
It makes sense, but that's us getting into people's businesses.
Yeah, I don't know if we can regulate business. Now, what we could do.
But we can regulate
is-
LMFTs.
Well, we could do best practices.
We
We
could
We
could,
do best practices.
well, it could be a best practice not to exploit associates.
Well, it's,
But
is
we
it
have to
a,
define what's exploitation.
Good point.
well, I mean, I think already we probably have a rule about you can't exploit. I don't know that we define exploitation.
Correct.
I don't know. attorneys.
This is,
A slippery
y'all,
slope.
y'all are not the only ones struggling with this. The LPC board, has a rule petition on this same topic that,
Really? Okay.
you know, associates are concerned about this. We're concerned about this. Y'all have clearly identified the difficulty of starting to regulate this because it is getting in outside the formal practice of therapy and into business relationships. Now, at the same time, what is unique about this situation is, but for your requirements of supervised experience, that business relationship would not necessarily exist. And so that does add a layer of where there may be some appropriate action to take, but figuring out what is appropriate and effective is difficult. So, it's on our radar and I think further discussion is definitely worthwhile. I don't know that we have any good answers for you today.
That's fine. No, I don't expect you to. I just basically am
Yes.
trying to put it out there because it's something I know that I have growing concern about. Yes.
I believe this is an issue in other states as well, and I'm curious if you guys know how other states manage this issue.
Go ahead, Romy.
I say, I don't know of any that regulate this kind of contract. The ones that I know of that regulate it don't allow payment. They don't allow supervisors to get paid.
They don't allow supervisors to get paid.
Okay, this is about, I mean, sometimes, like, seeing some of these places that are taking 50% aren't providing supervision. So they're just an employer. They're just LMFTs who are employing LMFT associates and not providing supervision at all.
So probably 10 years ago, we had the same discussion at the Psych Board. And we were doing what I called back then the supervision overhaul, where we were overhauling the entire supervision rules. And we looked at, we recognized that I called them supervision farms at the time, where people were just supervising way more than probably what they could actually provide supervision for, or charging exorbitant rates. And so we started kicking around the idea of, well, maybe we should just ban supervisor, paying for supervision, pay for play. And it caused a firestorm amongst the licensee population. So we quickly backed off on it.
Yeah.
Of course, now, as time has gone on, I feel like I would tend to view that as you're getting into the weeds of managing, governing the business aspect of it. And we just had that letter or that request from the governor's office to identify any kind of regulations that you have that affect the business or businesses, small businesses. They wanted us to identify what those were and kind of explain them, and then streamline it and eliminate whatever wasn't necessary. So we would be jumping right back into that pool if we moved in that direction. Long story short, I'm not sure that's the direction that the governor or the legislature would want us to go without them weighing into it first, is kind of where I'm going with this.
Well, also the practical side is we've got a shortage of supervisors. And so if you take away that incentive, then what do you do to the supply of demand for supervisors? I think there's other unintended consequences of doing that.
But it is kind of like mandating car insurance and then not regulating the insurers.
Yeah.
It's kind of what it feels like.
That's what I was wondering, if like even just requiring them to be transparent about what the money they collect goes to, it might even just help associates be able to better advocate for themselves, if that makes sense. Like that just might empower the advocates in a way, or the associates, I'm sorry.
Yeah, so from my perspective then, the best practice here could be educating the buyer, the buyer being the associate, and letting the associate know what the difference is, because, as a supervisor, this is a discussion that I have with other supervisors. How do you know, like a lot of people that are fully licensed that decide to become supervisors do it in order to scale their business. That is part of the point. So how do you do that without being predatory? And I think that it's very hard to regulate that. It's very hard to know I'm doing a good job or a bad job, but the associates are all new to the industry, right? And so I think having an educated buyer on this is a good deal, this is not a good deal. But if you Google it, an industry standard is absolutely, if you are a brand new green associate or intern, taking home 40% is the industry standard, and making more gradually over time, that's normal. As a fully licensed clinician at one point, I was taking home a third
No.
Yeah.
No, Nicole, no.
I know, right? At a group practice that I worked at as a fully licensed clinician.
Yeah, no. It's okay.
Is there a way, and I'm just spitballing here, so
Yeah.
don't immediately start writing rules, Robert.
Mhm.
Is there a way that you could create some sort of, almost like a certification? It wouldn't be mandatory that you have to have it, but if you get it, and you could post, we could have some sort of a roster or list and say, well, Nicole Richardson is both a supervisor, but she is also
An ethical
superstar.
supervisor or whatever.
And in order to meet it, you have to have the requirements. You don't charge more than
But isn't that a professional organization's job?
it is, but if they're not doing it.
You want us to do that?
That's what I'm saying, is, I mean, could you create something like that?
Maybe.
I'm just spitballing, so.
Maybe this is what if part of the, I mean, there's a 40-hour CE requirement to become a supervisor. And so what if we said that part of the CE, a certain chunk of that needs to be, how do you be an ethical supervisor if you have people working in your practice? Like, what does that look like? That might be something that's a little easier for us as a board to make happen. To bake it into the training.
So I heard supervisor and also heard employer,
Yeah,
so.
because I would hear
those
supervisors.
two
but not
different
necessarily our
things.
employers, yeah.
Two different things, yeah.
Right. Supervisor, maybe you could regulate. Employer, I don't know how you do
Well-
that, because this is no different than law firms, engineering firms.
Right.
When you start an engineering firm, you're not gonna get nearly what the principal rate is. You're gonna get a
That's
third.
right.
So that's,
So I don't allow anyone to work in my private practice. I am a supervisor, however.
Mhm.
And so part of my job is to help my associates advocate for them because they all work for someone or something else. And so part of my job with them is to help them understand is the policies and procedures wherever they are working, are those ethical, those appropriate? And so if my supervisee tells me, oh, they're gonna let me keep 30%. Part of my job is to go, nuh-uh, we're gonna keep applying. This isn't a good place for you.
Yeah.
So
okay.
I hear what you're saying, and that's totally fair, but I think that, you know, coming at this from two directions, one, educating the buyer, i.e. the supervisees, the associates, and then B, telling the supervisors, this is what you should be expecting of yourself and for your associates.
So the supervisee, are they getting pulled from the supervisor and the employee, or
They
those
could.
typically
They can.
one and the
They
same?
It can be
It's
two
often
people.
good.
Well,
going.
like I'm a supervisor, I don't employ any associates. All my associates have other sources of income, so different agencies, private practice, whatever.
Okay, so they're giving up dollars to the employer and
Right.
to you as a
And to
supervisor?
me.
Oh, wow,
And
okay.
the government for
Well, yeah,
taxes.
government's always gonna do.
But self-employment taxes, anyway, go ahead.
No, I just, I appreciate all this discussion. I will say we are getting far afield from the
I'm sorry.
agenda item. The board chair report.
Yes.
And before we start hashing out ideas that we cannot take action on.
Exactly.
Follow.
I also would just note, y'all can't see on your screen, but we have a member of the public, Monica Martorella. Thank you for your eagerness and raising your hand, but this was a moment of board discussion. So I can't allow you to input on this.
We'll do public comment later.
We might do public comment later, but we can't take any action on this item for now. We can bring it back on the agenda if y'all would like.
Well,
another
that's,
time.
yeah, yes. I just think this needs to be an ongoing conversation that we're having, and I'm hoping that through our supervisor survey, through our supervisee survey, the outreach committee has also been working on a document for guidance for supervisees and supervisors for our website. And so I am hoping that through all of this, we can, you know, it might be the only thing that we can do is empower associates. If that's all that we can do, fine. But I do want us to be attentive to this in some form or fashion, and I'm hoping that through our surveys that we can understand the issue a little bit better and then figure out exactly what action what action to take if we can't take an action. Okay. Well, I think, is that it for my board report? I think that might be it. Look at my list here. Yeah, Okay, we're moving then on to report from the board delegates, which is, myself and Mr. Hampton. And so let's see here. First announcement from BHEC is that we have, a new chair of the BHEC, which is, John, Belamowitz.
Well done.
Okay, yay. You have been chair now for like a month, right? You've been
Not
acting
even,
chair
not
for a
even,
while.
been confirmed by the Senate for like a week.
Okay, well, congratulations.
Thank you. Nice to see everybody. I was here for the psychology board meeting. I just thought I'd pop in before I went back to Dallas.
Yeah, so he did lead the meeting at least in February, maybe even a meeting before that. He did an excellent job, and so I'm excited to have him here. He has served on the psychology board for like 12 years or something.
Not that long,
Oh, not that
but
long.
about, or has it been that long?
Yeah,
It's
it's
2016. So yeah, so I can't count. Yeah.
Just 11.
It's 11, yeah, or something anyways. And so, anyways, so just welcome.
Thank you for letting me crash your meeting. I look forward to getting to know y'all more.
Yeah. We also have a new website, that, Daryl and the team designed, and it looks really good. So if you haven't seen the new website, I encourage y'all to go check that out. I feel like it is much more user friendly, so thank you for that. CE Broker, is, ready to go September 1st, right?
Well, that's what we're shooting for.
Yeah, so there will be, probably lots of announcements and education coming out about that. I'm really excited about CE Broker. Let's see here. I do know that we put in some budget requests, to, the legislature this year, and I do believe that we did get funding to fill like 10 positions. Is that right?
In the Senate, on the Senate side, yes, on the House side, no.
Okay.
So we are waiting to hear what conference committee comes out and says. So I'm expecting that just any day now.
Okay, so we're still waiting to hear about some funding issues. I know that we also requested money to fund a new psych exam, and I think we're still waiting to hear from that as well. Okay, let's see here. And then in your board packet, we had lots of information. The first thing we had was kind of a summary of the rules that passed for the last BHEC meeting. The big list of, in the summary, the ones that were published and adopted, that kind of wraps up our quadrennial rule review. So that is all now done and behind us. I am curious, one of the rules that we passed in BHEC was about, oh my gosh, whenever you have somebody doing coaching, or somebody who has like a side business that is somewhat, somewhat related to what you do as a licensee. Did we get any public comment on that one? Did BHEC get any public comment on that?
Very little. So it was proposed. It hasn't been adopted yet.
proposed, yeah.
Yeah, it'll be up for adoption in June. And I think we got 3 comments for, 2 comments against,
Okay.
something like that.
Did the comments again say why they were against it?
One just was against life coaching. So didn't want it.
Just generally against it?
And the other,
That wasn't me.
yeah, the other comment, I think, was more of a form over function, that there needed to be more notice given.
Oh, well, this is our notice. This is your notice, right? Okay. The BHEC Rules Committee, we're meeting every other week. Or, I'm sorry, not every other week, every other month. At our last meeting, we discussed possible rules related to limiting the length of an open application to 6 months. And then we also considered another rule that would allow licensees to move from delinquent status to inactive status. So like if you forget to renew your license and then you just want to go inactive, the way it works now is you have to like reactivate your license and then deactivate it. And so this would just allow somebody to go from delinquent to inactive. The BHEC Rules Committee is also considering reinstating the Standardization Committee, which would include both the BHEC members and professional associations to take up examining rules regarding emerging practice, so things like AI or psychedelics, and then also how to like end your practice. So if your practice is ending, what do you do about your records? What do you do when you find clients and things like that? So that will hopefully be taken up in the Standardization Committee sometime in the future. So anything else y'all want to say about BHEC at this juncture?
Question about the one about ending of practice. If someone dies while they are still in practice, would it also kind of have a language for whoever is meant to kind of shut the practice down?
Yeah.
Yes, okay.
Yeah.
We're looking, what I want to see us kind of move towards is kind of what this, kind of how the state bar handles it. They have a very, very robust system for handling that. Needs some tweaking for y'all's profession, obviously, but yeah. We're trying to handle it from both when you retire, if you become incapacitated, get capable of and then with death or permanent incapacity, it will need to encompass all three of those situations.
Okay, the next thing in your board packet, was just like, there's just a bunch of stuff in there, quarterly reports, some, I don't know, did y'all have any questions about the quarterly, measures of performance? I had one question, but did y'all have any questions? Okay, my one question, I guess I'm curious, the quarterly, measures of performance, are those available to the public? Like, are those a part of the public materials? Thank you,
Yes.
Dawn. Okay, cool. Well, then I really appreciate y'all's transparency with that. So thank you all for releasing that information. On page 2, what is a legal review? Like, what it says it's under, they're under legal review. Does that just mean that like the attorneys are looking at the case to decide if it should be dismissed? Is that what legal review is?
Where you at, Doc?
Which document are you
Which
looking at?
The quarterly measures of performance.
There's a performance measures and there's performance measures and calculations.
Ooh, hang on.
Is it 4BC1, 4BC2?
Is it
Or-
a landscape one or a portrait one?
No, I'm gonna go back to it now.
So I think you're talking about the,
4BC1, I think.
the complaints pending.
Mhm.
And so, yes, that measure is, so we, when a complaint comes in, it starts on the investigation side of the house.
Okay,
And the investigators do their work and get all the information built up, and then it goes to the legal side of the house and the attorneys review it. Do the ISCs and, take action. There are 14 investigators, I forget the number,
About 14.
14 investigators and 4 attorneys.
okay,
So it's stacking up in the attorney side.
okay, cool, okay. But that's where maybe if we get money from, okay,
That's some of the money that we've asked for is to fund,
some attorneys.
2 new attorneys, yeah.
Okay, cool, okay. Any other questions about the quarterly performance measures? Okay, the next thing is, we had the listening hour reports. Thank y'all again for always being so transparent and doing the listening hours. I listened to part of it on the YouTube, and so just, again, thank y'all for doing that. Any questions or comments about the, listening hour report?
We have
Actually,
another on Monday. Sorry. No, go ahead. I was just saying we have another on Monday.
And I will be there. I had a question because I've never really understood the rhyme or reason. For the insights over the lunch hour, there's a Q&A and then there's interaction with the participants. And then for the leadership listening hour, it says the Q&A feature was disabled. Help us understand kind of the rationale for when it's used and when it's not.
We're probably going to discontinue the Q&A for the insights over the lunch hour in addition to the leadership, because it's too hard to manage answering the questions and the volume of questions that come in on the Q&A. Plus, we've also noticed people use the Q&A as a chat and they start answering one another, and then it becomes almost impossible to track what you originally asked, and then you're having to correct people when they give the wrong answer. And so we're just like, no, this is designed so that you talk with us and, we get to interact with you. So we don't want to do it through the Q&A. We want you to actually talk to us so we can deal with you directly.
Makes sense. Thanks.
Then we have, the TAS guidelines. So this was reviewed in the outreach committee. I saw Jody's comment on there, which I like. But I have some other ideas for changes. Do we want to talk about those right now, or do you just want me to like email them to y'all later?
You just email them to us unless they're.
No,
Or
they're like,
shattering.
no, they're like just little small, like, Let me just reword this. Were there any other questions or comments about the TAS guidelines?
I like them. I like, Dr. Elder, your comments that you put in there. I thought that was very well done.
Thank you.
Then we also have the social media guidelines, and again, that was also reviewed in the outreach committee, and then passed it on to the attorneys for their review. Again, I have some questions about that too. Okay, I'm gonna ask those here though, because I really am curious, and it might be helpful to have all of our input. Let me pull it up really quick. Yeah, the social media guidelines. Okay, so one of the lines says, where does it go? When providing professional online services to multiple clients, discourage clients from sharing private information unless using a HIPAA compliant portal. I guess I just don't understand this line.
Where is it?
I think when we talked about it in
the
committee,
Uh-huh.
we were talking about, what if this was not yesterday, so forgive me if I'm remembering this wrong, but I think our thought process was, what if this was some sort of like online support group or online therapy group that was somehow private and locked down? And so if somebody was in their safe, sort of protected online bubble, then they would be able to, because I think one of the examples we've used, what if a therapist goes live with certain clients on Facebook, for example? And if there was a way to have that be a private group, where only clients are invited, would they be allowed? And so I think that was what we were talking about. I don't think there's anything wrong with taking that language out, but I think that's what we were kind of kicking around when that line came up.
Yeah, I can't remember. I just thought at the end, unless using a HIPAA compliant portal, and I feel like if you're providing any kind of services to clients online, you're going to be using a HIPAA compliant portal. I don't know.
No, well, Facebook isn't.
It's not.
Well, but you would be providing services to clients on Facebook.
We hope.
And perhaps that's why we added that in there, is
Yes.
to kind of underscore, if this isn't a HIPAA compliant platform, then you shouldn't be doing that.
Yeah, and I'm finding that there's a lot of the associates, now associates coming out of grad school, they understand HIPAA. But I find that there's many clinicians that just don't adhere to HIPAA. They know it, they hear it, they misspell it and all that kind of stuff, but they don't utilize HIPAA protocols as mandated by the federal government. So having a BAA using something that is legitimate,
Yeah.
you can't use your regular text to text unless it's just scheduling, confirming, that gets a pass, but you can't do therapy. But everybody's used to doing therapy. Clients are used to asking clinical questions on text, email. And I think we just need to reemphasize that we don't encourage that.
Well, I thought maybe this, so it's like multiple services to multiple clients. Like it made me think like maybe doing some sort of group therapy, but
That's what it sounded like to me.
That's
If
what
in
we
a
were
group.
talking about in the committee. And so what's the difference? For example, I mean, I realize this is kind of a dumb question, but what's the difference between having group therapy, say on Zoom, versus going live in a private group on Facebook? By the way, I don't use Facebook, so I might be making up a technology that doesn't exist. But my understanding is that you would have something like that on Facebook. I don't know. So kind of underscoring, hey, if it's not HIPAA compliant, don't do that.
yeah. I don't know. I mean, we can keep it. I just was like, it didn't make,
We don't have to.
I just wasn't sure exactly what situation it was referring to. And I guess the part that I was worried about was that people would think that there might be some time when they are allowed to use a non-HIPAA compliant portal to provide online services.
So would at the risk of drafting in conversation, would it make sense to simply say, discourage clients from sharing private information unless using a HIPAA compliant portal? Just full stop. Whatever situation, wherever you are, whatever's happening, discourage clients from sharing private information if you're not on the HIPAA platform.
I like that.
That simplifies it
Yeah. Okay, I mean, we can simplify to say that.
and makes it general enough to use for individuals.
I like that too, because I agree with you, Dr. Merchant. It implies that there's some way to do it online that's not HIPAA compliant as long as people aren't sharing and spilling their guts, and that's not okay.
Then there's also a bullet that says communicate and engage in social media in personal and professional settings with civility and respect for others. And while I do agree that we should do that, people often don't do that. I'm just wondering if we need to keep that on here, if that's something that needs to be.
Well, it's a best practice. Remember, it's not a rule.
Right.
It's not a practice.
And how do you monitor that?
Well, it's not enforceable. It's a
Right,
best practice.
exactly.
Right?
But I feel like some of these other things are not, like they're actually tied to rules, and I don't feel like this one is. I don't know, I'm just wondering if it should be there or not.
I mean, it's a guideline, so we're never going to use this to cite to you didn't follow this guideline, we're gonna take action against you. The guideline is really just there to inform and hopefully provide some guidance,
So
so.
there is a group of complaints, a category of complaints that this would go to keep you out of, keep you from falling into. And that is, if you've ever seen, we have probably 17 or 20 different categories of complaints. One of them is unprofessional conduct. And all the complaints about, well, Dr. Partee was mean to me and was used rough language with me in our session. And that gets categorized as as unprofessional conduct. This kind of addresses that. It tells you, hey, be nice, be civil, be courteous.
And I like keeping it in there because it's not uncommon that so often and so frequently social media is used to flame other people and to vomit their thoughts and feelings and stuff. And it wouldn't be a big stretch if a clinician gets caught up in that. And they have this back and forth and back and forth.
But the thing is, even if they got caught up in that, and they had this big ugly back and forth, and were calling people horrible things, if somebody reported that to the board, we wouldn't do anything about it.
No, we would do something about it.
No, we would not.
No, we wouldn't.
It's a First Amendment right.
Okay, so if let's say that I fell down a rabbit hole on Facebook about the new design of Legos. And I got.
Are they
mean about it.
terrible? Okay,
I'm making something up.
okay. I was wondering about when.
And I got
don't know.
mean to somebody that was posting about how much they like the new design of the Legos.
Okay.
And I called them names and I was a real jerk
Okay.
about it. I will try to project my voice a little bit more about Legos.
Yes.
So I got mean, and maybe I have a separate personal account, but I got mean and I started calling somebody names.
With the client.
Nope, this isn't,
Oh.
this has nothing to do with clients. This is
Okay.
just saying I shouldn't be a turd on the internet. That's all this is saying.
Okay.
So I went down a rabbit hole about Legos. I got mean to strangers about it. Somebody knows I'm a therapist, takes screenshots and sends it to the board as a complaint. We're not gonna do anything about it. I get to be a turd about Legos. It's not a good look. I shouldn't be. But I can. Is that loud enough?
Thank you. You scared a whole lot of people talking about Legos.
Yeah.
The most innocuous
There were a
thing I
bunch of
think.
parents on this call that were like, they're changing Legos.
Now,
Oh.
Comments?
maybe-
Exactly.
It's happening for later.
but where
I will
where
say-
would that fall?
We're, correct, we would not, anything outside of professional relationship is not the jurisdiction of the board.
It's not a good look,
It's not
but
a
it's
licensed
not in our
activity.
jurisdiction.
Well, again, I think it goes back to the purpose of this document. It's a best practice. It's not a minimum standard. And so we wouldn't enforce it anyway.
Also true. I will say we are not in a rush to put this up on the website.
Yeah,
So
I mean, it's already there.
the existing ones are there. Very welcome. Now that y'all have seen this and had this conversation, I think staff would be very welcoming of any comments you each have. Send them to Sarah and we'll incorporate and we can either bring it back to the board next time or send it back to the committee if we think it needs more.
Okay, the bottom part of this
About to
document says BHEC has the authority to discipline licensees for unprofessional behavior relating to the inappropriate use of social media. But it doesn't say in your clinical practice. It says if you're a licensee, and it does mention any engagement in online discriminatory language or practices, online derogatory remarks or regarding a client or use of the internet for unprofessional behavior. Isn't that now enforceable that if you do blow up with somebody on your own time
So even.
as a licensee, you could,
So, we could probably make that sentence more clear that it is limited to professional relationships.
Yes.
Yeah.
B, no matter what we said on this document,
And it's enforceable.
it's not enforced. This document does not create any sort of powers or duties of the board. But that being said, we don't want a document out there that says we can regulate the flavors of ice cream. We can't, and let's not tell people that we can't. So yeah, we could probably be more careful with the articulation. of
I
that.
read that more as like a warning, like, hey, like, be aware that if you behave badly and you're not thoughtful of how you show up on the internet, it could come back to bite you in the rear end. Not necessarily about Legos, but it could bite you in the butt.
but it could include Legos.
It could, but I doubt
Or
it.
ice
Just
cream.
want to be clear. Or ice cream.
Big stretch, big stretch.
Okay, yeah, I think clarifying that to delineate that in clinical practice or some kind of caveat with that. But I do like the idea of putting that out there, just saying, be professional, be reasonable, whatever it may be.
So is it?
Within a professional relationship.
Okay. Anyways, I'm actually really liking Legos.
Yeah.
Flowers. You seen those? Really pretty. Anyway. I was trying to. It's like that scene in Ghostbusters when he was like, I tried to think of the least scary thing and. Yeah, that's. Yes, exactly that.
Okay, well, that was good.
So we'll take this feedback and
Okay.
there's no action on this item anyway.
Right.
We'll take the feedback and bring it back to y'all.
Because we won't be meeting until September, is it possible for you to, was the board comfortable if they bring this back to the outreach committee and then the outreach committee can just approve it to put on the website? Or does it have to come back to the entire board?
Committee's fine.
Okay,
You want to delegate it to the committee to approve it.
is that fine to just delegate it to the community? Yeah.
Again, it's not enforceable. We can't,
Exactly, yeah.
yeah.
Okay,
I'd like to recommend that we delegate it to the committee.
okay, thank you. We will do that.
Understood.
Okay, let me see here. Where are we on our agenda? Okay, I think that actually concludes the BHEC report, unless there's any additional questions, comments about any of the documents that were provided, or if anybody else has just anything they want to say about BHEC. Okay, then we'll move on to agenda item number 3C, report from the board administrator.
Thank you. So I prepared for the board members, some written reports, regarding, I don't know if I did it in writing for TAM. I presented at TAMFT. An attendee when I was at the table asked for a presentation at Texas Women's University for their master's and doctoral students. I did a webinar presentation with them on April 10th. There were about 14 participants that were able to come. And they asked for a video recording of the thing so that they could provide it to their students. I provided that recording and warned them that as soon as it was recorded, things can change. Asked them to include that caveat and welcome them anytime they want another webinar. I'm happy to provide as long as we can get schedules to align. I think that concludes, I included in your materials the second quarter performance measures and calculations. Those will be presented on June 24th to the council, so I don't have any additional information regarding that. And I think that concludes my report unless you have any questions about the materials.
I have a question.
Yes, ma'am.
So the material you provided about grad students and how to walk them through sitting for the exam in their last semester and getting licensed is amazing. And I want to share it, but I didn't want to do that without asking permission first. Is that shareable material?
Yes, and in fact, in fact, I'm using that as a basis to update the applying for a license web pages on our new site. So it will be even easier to share as soon as I can get back to drafting that. And I want to thank Robert for all his work because he does a lot of the posting and editing for our website. So that will be up shortly, but absolutely, if the form you have right now works for you, please share.
Okay.
And I'll make notice to the board members when I've got the applying for a license pages updated on the website.
Thank you.
Thank you. Okay, then we will move on to D, which is report from committees. And so Dr. Elder, you're up first with a report from the Ethics Committee.
Got it. Okay, so the Ethics Committee met May 5th. We reviewed 8 cases, 7 of whom had been adjudicated between the last time we met as a board and 1 that was a follow-up from our previous Ethics Committee meeting in January. Upon review of all of the materials, the committee agreed with all of the decisions regarding adjudication of the complaints, even the one that was under further review. The outcome of that further review was that there were some tweaks made to the investigation process. I think one of the things that fueled our need for more information was that there was kind of a witness to the alleged offensive behavior that we were wondering, why wasn't that person interviewed? Why weren't they included in the investigation? And so now the investigative process there will be on the report a list of any extraneous witnesses with an explanation of why they were or were not interviewed as part of the investigation. And I think that's very helpful, and I appreciate the staff being so open to our feedback and our needs as we reviewed those things. Another thing that came up in that meeting was that when there are allegations of sexual misconduct, Dr. Merchant mentioned that it might behoove us and enhance public protection if we are sure that we have a public committee member as part of the adjudication of those cases, not just professional members when ethical cases involving sexual misconduct happen. And I think that that was a decision that we'll implement moving forward. Anybody who was part of that meeting want to add anything from that meeting?
Now, I'll just say that I think for like the sexual misconduct cases or just priority 1 cases, am I not loud enough either? Oh my gosh. Okay. Where's like our microphone so I can talk at it?
Ceiling somewhere.
Okay. So.
Just 10%. Y'all aren't
Okay.
terrible. Just a
little bit higher.
Yeah.
Okay. I feel like my
It's-
teaching voice. or
It's 2
something.
PM. We're fading. from the
Okay.
effort. You're maxed out.
Yep.
Basically, I think for our priority 1 cases, we just want to include 2 professional members and 1 public member. Just again, these cases, I'm gonna be honest, are really hard to sometimes adjudicate. I know that before I was on the board, I was like, oh man, if you've had any kind of sexual relations with a client, like you're out, in these cases, they're sometimes a lot more complex than like you would think. I think that sometimes people aren't quite as predatory as like, I don't know, they're not always as predatory as you would think that somebody would maybe possibly be. I think sometimes there's self-care issues, there are boundary issues that maybe lead to this behavior. And so I just think it's for public protection. I think it's good to have, a slightly larger team hearing these cases. So that's all. Okay. Thank you, Jody. Okay, I chair the Licensing Standards Committee, and so we heard two cases, this quarter. The first was just from an associate who had misreported her hours on her, supervised experience verification form. And that resulted in complaints against her and her two supervisors. And so for any supervisors who are listening, I would just encourage you to be, really careful about filling out those forms, make sure you're filling them out correctly, watch all those dates, watch all those numbers, maintain your supervision log, track your supervisee's hours. You know, just do all the things you're supposed to do, to make sure that hours get reported correctly. Then we also heard a case, about somebody who had some academic deficiencies. And so we issued them the license and also issued an eligibility order to help them, remediate some coursework problems they had run into. And then I also approved one study plan. So again, if somebody has taken the licensing exam more than 3 times, they have to submit a study plan, and then we approve those. So, any questions about the licensing standards report? Okay. Next, we have the outreach committee report. We met in both January and April. We reviewed the social media guidelines. We reviewed the TAS guidelines. We are also working on some supervision guidelines. I'm really excited about that because I don't know. I feel like the outreach committee has just done a really good job on that. So we're going to wait though to do the to finalize the supervision guidance document until after we have done our supervision surveys. Just so that once we have that data, there might be ways that we want to update our supervision guidance. So, any questions about the outreach committee and what we're working on?
Quick question on
Yeah.
the surveys for the supervisors and the
Supervisees.
supervisees.
Mhm.
Is there a timetable for that? Cause I
Yeah.
know we have the draft documents.
Yeah, we're
Oh,
gonna,
with
my hope is to do the supervisee survey in June.
June.
And then once we can, review the results of the supervisee survey, then, we'll probably maybe modify some of the questions on the supervisor survey. And then do the supervisor survey hopefully this fall. And then go from there.
See what comes. Okay, good.
So we'll see how it goes. Okay, and then we have the report from the Professional Development Committee, and that's you, Dr. Barteen.
Yes, we met also in January and again in April and doing the on the CEs, the CE survey. The survey was put together. Thank you, Sarah, for all that, getting all that out. We sent that to about somewhere between 5,000 and 5,600 LMFTs, LMFT associates, and LMFT supervisors. Collected data for 6 weeks, February and March was the collection time period. Out of that, we received 681 surveys, 12% response. We gotta bump that up, but that's okay.
It's still, I thought we'd maybe get 100, so the fact that we got 600, I'm actually pretty.
I know, right? Isn't that great? So we do
Yeah.
we got some, so that's 12%. We met on April 14th to take a look at the first iteration of the raw data. There were 16 questions that were asked, and we started to see the split out of that. And so we are meeting again in June 20 to kind of coalesce all of the results of that and make some determinations of action items, and would present that to the fall board meeting, not the summer board meeting.
So we do have like an action, or not an action item, we do have an agenda item related to the CE survey results, but we are going to skip over that because we don't really have any good recommendations for you at this point.
Yeah.
And so we'll come back in the fall and have another conversation about this stuff.
Yes.
And then the rules committee, well, any questions about that before we move on?
No, just good work that y'all did on getting the data together and the charts and all that good stuff.
Aren't they pretty? Yeah.
These turned out lovely.
Thank you.
Look like Legos.
Nice visual.
Thank you. Okay, then we have the rules committee. We met and we had some proposed rules and they are in your packet. So we will get to those in a minute. Okay, agenda item number 5, discussion and transition to free digital licenses and optional printed wall certificates.
So this is just an informational item for y'all. This is something staff is working on transitioning to. It will take a little while because it will take some software configuration and database changes. Right now, when someone gets a license and their license is approved, they have to request, or we have to print out and they pay for a printed license. We print it out and we mailed it to them. And then sometimes they get returned and we gotta find them. It's a whole thing. And we feel like we're in a digital age. So instead, what they get right now are these kind of this shape and size document. Sorry for those online, it's a 8x12 normal sheet of paper. We're going to have our system generate a secure, non-changeable certificate upon issuance of the license. So that it will either be emailed to them or it will be in their profile so that they can print it on whatever cardstock or nice paper they want. They can frame it if they want. And if they lose it or they have a second office open up, whatever it is, they can just go in for free, print out another one. Doesn't require them coming to us, doesn't require work on our staff. We just take care of it. Now, we realize that's not as ceremonial as some folks would like. Y'all have worked hard to get your license and get your education. So right now, only psychologists can do this, but we're going to transition to everyone can get one of these big vellum, fancy printed, starred, certificates. And so these will be available for purchase. That you'll have to pay for these, and they're printed by the Texas House Print Shop. But everybody will be able to do that. And so you will have a free option if that's what you want. You can print it out, or you can pay for this nice big one that if you want to frame and put it on your wall. The council has not determined that yet. We have to get that rule changed. So.
I didn't hear the question. Was the question about the fee?
The fee, yeah.
How much it would cost.
The fee has not been determined yet. So, no action needed by y'all. We just letting folks know this is something that will happen probably by January.
I remember right, and I may not be remembering correctly, but I think there's an $11 charge to get a name change on there. Would there be a fee associated in getting a new digital copy when your name changes?
We will have to work out the software for that. So right now, everyone can go online and do their own name change in the profile. But this is what's called the wall cert name. And honestly, I would have to ask staff over the database whether or not the
I believe they have to show proof of that name change before staff will change it.
before it'll go.
What they put in their profile,
Yeah, we
It's
would
up
have
to
to
them.
work that out.
So what you're asking is, are you gonna have to pay to have the, yeah.
Yes.
I'll have to look at that, but we'll try to make it so that there is a free option for printing out a certificate that you can just go on your profile and do without interacting with us. We'll adjust it for the name change.
Thank you.
You're welcome.
Okay, let's move on. Any other questions about that before we move on? Okay, then we'll move on to agenda item number 6, licensing matters.
so we have Mr. Christopher O'Neill Jones, application for LMFT associate. There was staff opined that there was not a qualifying degree. He has a master's in divinity with, from another institution, coursework in marriage and family therapy. Mr. Jones is here. Saw his name earlier. Mr. Jones, would you like to address the board? Can you unmute? There you go.
Oh, we still can't hear you, Mr. Jones. It looks like you're unmuted. You check the audio setting and make sure your microphone is selected. No, still. If you'll look at the bottom left of your screen, there should be an audio button with a little arrow. And if you click the arrow, there should be an option for selecting a microphone and a speaker. You can also test the speaker and microphone. If we can't hear you, you might consider, you could try logging out of the meeting and logging back in. Sometimes that will reset whatever's wrong.
The chat, we use the chat to communicate with you.
Possibly. No, the webinar, don't think attendees, but possibly, Mr. Jones, if you see the chat function at the bottom, perhaps try typing something if that's allowed.
I changed it to everyone can chat.
Do you call in or?
Yeah, you're also welcome to use the call-in information.
Mr. Jones, if you're there, just raise your hand so we know you're actually there.
Well, you're unmuted.
Did he unmute?
Yeah.
Yeah.
Do we want to maybe move on in the agenda and then come back and,
Leave him up,
okay,
and then if he gets it figured out, we'll hear it.
we'll come back then, yeah.
Yeah.
Okay. Okay, back to my agenda. Okay, then for now, we will move on to, agenda item number 7, examination matters, board review and possible action related to change in the board jurisprudence exam. I have a question, but does anybody else have any questions or comments? Okay, why did only one person reported their level of licensure? Was that one of the errors that they picked up on?
I didn't notice that. It could.
It's reported later on. It's like question 4 appeared twice, and later on, like one of the last questions on it, it shows level of licensure. I had the same question.
Okay. Okay.
Thank you.
I also had a question, Ms. Fassholz. I know in our January meeting, we noted that we didn't have really any comments, and then again this time, but it says the issue has been corrected. Thank you for following up on that. What happened?
I didn't get a lot of explanation from the vendor. I got a, oh, yes, we've corrected that, kind of response. And I explained that this had been an issue in the previous quarter with that not that we had none, but that we had significantly fewer than we normally do. And I think that until it was absolutely broken, they weren't able to find what the problem was. But I did not get a technical explanation, which I wouldn't have understood anyway.
Well, thank you for following up on it just to make sure it's fixed.
Sure, I will, I can run a report at any time. I usually wait until the end of the quarter. But given that this has happened now almost 2 quarters in a row, I'll make note to run a report again on Monday and just see what we got. And then talk to the vendor again if needed.
Sounds great. Thanks.
Madam Chair, it looks like Christopher Jones is back on.
Okay.
I don't know. Mr. Jones, can you try speaking again?
All right. Can you hear me this time?
Yes.
Okay, good. Talk about nerve-wracking. Okay.
I'm so sorry.
Well, thanks to your time. And this is actually my first meeting that I've attended. And it's glad to know you exist and what you're doing. And a lot of excellent conversations. I come from an ethics background, so I look forward to jumping in and listening. I guess it's a bi-monthly meeting in the future. So thank you guys for what you're doing.
Excellent. Well, I guess, Mr. Jones, for one thing, make sure you stay right up next to your microphone because you're kind of fading in and out.
Okay.
If you would provide any explanation, obviously we have, as staff, have told the board why we did not feel your degrees met the requirements. If you have anything to tell the board about why you believe your degree should count or why we were wrong as staff. That would be helpful.
Okay. Thank you so much for your time. All right. So I respect your decision. I just believe that some MDivs might receive an exception. I received a Master's of Divinity from Princeton Seminary in 2006. The particular program I was a part of, it's called Pastoral Counseling. Now, pastoral counseling predates Christian counseling as well as biblical counseling. It was basically an attempt of clergy to state we're bona fide therapists next to marriage and family therapy. As a matter of fact, that department was kind of ridiculed by the other areas of theology, whether it's biblical studies, stating that you're not truly theological. You're basically, I guess, moonlighting as marriage and family therapists in a theological seminary. While at Princeton, I actually completed 36 hours that are either clinical or quite clinical. For example, there's a course called Pastor as Person, which is a survey of Christian counseling. It's very similar to the introduction of marriage and family therapy that I've taken at an institution called Turo. Feminist and womanist theologies is basically multicultural and gender thought to where we understood the psychology of women, but we also wanted to talk about the religious underpinnings that would undergird just any type of oppression, as well as some of the thoughts that might cause women to feel secondary and how that could play a role in their marriage. Sexuality in the Christian body was basically sex therapy. Addiction and grace, it taught about the social learning model, the moral model, as well as the medical models of addiction. And we had weekly clinical experiences of at least 3 hours per week to where we worked with someone. Cultural identity and the sacred was an attempt to understand what people view as sacred and how that might not be religious, then again, how it might be religious. The way that played a part in my clinical practice is that there's quite a bit of shaming and guilt that was going on. In many MFT programs, you don't deal with those theological and religious underpinnings, whereas we focused on that for an entire semester. And then there's some additional courses, but I know that my time is limited. So just the theological coursework that I did. Some seminaries, they are really there for preaching, they're really there for teaching. But Princeton is unique in that it has a huge faculty, and each of these faculty members had worked full time between 5 to 10 years working as a counseling professional. So when I learned that the MDiv could potentially qualify as a related program, I applied and I was informed that it doesn't exactly qualify, but I also stated not only do I have those 36 hours, but I have an additional 36 hours from a COAMT program. And so my argument was, if we're looking at qualifications and experience, I have that. I've also attended a full-time 12-month, 40-hour-a-week clinical practice at the VA hospital where I was trained in bereavement therapy, marriage and family therapy, as well as addiction, addiction and trauma, focusing primarily on military sexual trauma. So the concern as I read it is that I didn't have sufficient clinical experience. I'm quite sure I do, but also I've been working for almost 21 years full time in this field, and I carry a load of no fewer than 15, no larger than 25 persons. Everyone is private pay in what I do. And I also have a 91% success rate with couples, and I specialize in on the brink couples who are at or near divorce. So I think that my situation is a little unique, and my educational background might not be the typical MDiv. And I could understand that you don't want just anyone becoming a therapist. But if there's an MDiv program that really is training you to work full time in a congregation as an actual therapist, and some persons would follow that up with additional coursework to be licensed. Um, I would think that maybe I could be declared eligible. I might have a deficiency in one area, but for my application to be outright denied, I'm just asking for additional consideration.
Thank you very much. I appreciate that. I always have thoughts. I have thoughts, but I want to hear from the board first. So what thoughts do y'all have? Or who would like to start off our conversation? Well, then I will go first. I mean, I guess to me, an MDiv with a specialization in pastoral care and counseling, that would be a related degree. Am I crazy to think that?
No.
Okay. Do you think it'd be a related degree also?
I understood, the argument that he was making, with the information he provided.
Speak up.
I understood the information that he provided both today in our meeting as well as, by giving us his, CV. I did understand the comparison he was attempting to make.
Okay, so do you feel like an MDiv in pastoral care and counseling is a related degree?
I think it can be.
I think it can be too.
This is Dr. Elder. I do believe too that it can be. My concern is that we have to, it can't be coursework from several different programs. It has to be one program that included those hours by a certain time for it to count under the 2017. One of those programs does, the other does not. And I would love to see someone with the experience and breadth of knowledge as Mr. Jones to join our field. My concern is our hands are tied by, in some ways, by statutory requirements at that degree. And also, I read everything that was submitted, and we saw very clear syllabi from Touro, I don't know if I said that right, Touro University, that was the co-empty university, that was clearly MFT coursework. But the overall descriptions of the Princeton Seminary coursework did not sound MFT. So perhaps it was, but I didn't read that in the general course descriptions as presented.
Okay, but what, I'm not sure that they all have to come from the same university. I mean, sometimes we have people who have to go back, their coursework doesn't meet the requirements, and they have to go back and get additional coursework from a second university. So I'm not sure that necessarily all has to come from one university.
Okay.
If I may, for the board's consideration, the language is such that for, if you're looking at 801.114 under subsection A, if you're for your particular course requirements, but if it's you started your program on or before August of 2017, then you look under subsection B for your course requirements. When staff is looking at when someone started their program, they're generally looking at when was their first course on a transcript that results in a master's or doctoral degree that's related, at least related to marriage and family therapy. We can't use, I got my master's in business administration and then I got a master's in MFT. I'd have to use the date that they started an MFT course, not a date that they started an accounting course. So that's kind of how we parse that out. We do accept, staff calls it a Frankenstein. There's some coursework here and some coursework here, but statute requires a degree in marriage and family therapy or a degree that's related from a program that is, and I'm going to get the language garbled, but from a program that is designed to train someone in counseling. And we did, while we saw some coursework that may apply under the Princeton Masters of Divinity, we didn't think that the coursework as a whole was designed to teach someone to be a counselor or to be a marriage and family therapist.
Yeah, Princeton does not have a MFT degree.
So the MDiv degree from Princeton, most of the people that matriculate from that degree, what do they end up doing? Do we know that? Do we know if they go on to be counselors? Do they go on to be pastors? Do they go on to be something else? We don't know.
I have no data to tell you on that.
Okay.
I would assume that they probably go on to be maybe pastoral counselors, but I don't know. I also don't know the licensing rules of, Princeton's in New Jersey, right? Is that
Yes.
right? Okay.
Yes.
I don't know the licensing rules there either, and if that degree would qualify for licensing in New Jersey or not.
if I'm completely honest, when I got done reviewing all of the material and there was a lot, I really was on the fence about what my thoughts were, because I can understand Mr. Jones's argument, and I can also understand why the staff decided what they decided. And so I think I was leaning towards agreeing with the staff, but it was not a black and white deal for me. I do understand, Mr. Jones's argument, and I see where he's coming from.
I mean, it seems like the main issue that we're here to decide is whether or not the Masters of Arts in Divinity is a related degree.
That, and do the other classes he took, as Sarah pointed out, is it enough to knit together to Frankenstein it?
Are we deciding that too? Or are we just deciding if it's a related degree?
At this point, the degree, I think staff expressed to Mr. Jones, but I don't have it in front of my notes. I don't know that we did a full academic review, because if there's not an underlying degree.
Right.
But, I'm looking for that.
So, but yes, we would probably ask that if you believe this candidate should move forward, that you instruct us to accept the underlying degrees as relevant and related to MFT, but then let us do a full review to make sure the course content is met.
Right.
And then I think to his point, he might be deficient in an individual course, but could make up that course by taking additional coursework. I will note his hand is raised.
Oh, yes. Yes, Mr. Jones.
You're on mute, Mr. Jones.
There we go.
There you go.
Can you hear me now?
Yes.
Yes.
Okay. All right. So 20 years ago was when I completed the MDiv. And during that time, the majority of woman clergy actually went into full-time pastoral counseling. It's a little different now. Now the majority are going into chaplaincy, working in clinical chaplaincy or pastoral ministry. But the goal was during that time through the pastoral department to actually have chaplains and pastoral counselors who could work on par with a marriage and family therapist. This drastically changed in 2020. So now Princeton, as well as many seminaries, are trying to become much more intentional about having a pathway to go forward into licensure if you desire to go there. But at that time, these courses had different, the wordings was more of something that a preacher would say, but the content itself was on par with what Rutgers University required of their Masters of Social Work students, as well as licensed professional counselors, whatever they were calling that thing. So the coursework was very similar, technically even more rigorous than what I've taken it to.
Thank you, Mr. Jones.
I
Any
think it's
comments?
hard for me to decide personally if this is a related degree until I see the coursework, because again, just reading the big summary, it's theology, it's not counseling. But what Mr. Jones is reporting he did in class is counseling and marriage and family therapy. So I feel like I could make a better decision about whether it's a related degree if I actually saw the syllabi.
I think the syllabi aren't they, well, maybe not, I don't know.
I think there were some.
Yeah.
Course description.
There were syllabi for the Truro University from the MFT program. There were course descriptions only for the Princeton Seminary coursework.
And mainly, our staff process is to stop looking if an underlying degree is not
Right.
related, not to define whether it is related based on the underlying coursework. Because if we do that, then there's no point to having a
Right.
degree requirement. We'll just look at everyone's transcript and look at every course
Yeah.
to see if it meets. And that's too much of a hurdle for our staff to do.
Right.
But so in this instance, you can direct us to do that for this applicant, and we will, and we'll look to see whether all the individual courses meet the content area, and we will get the syllabi from Mr. Jones and do that.
Patrick?
I don't know if this helps or not, but it's just for informational purposes, because looking at the LPC rules and probably the thinking that staff had is they do define counseling related fields. And it specifically states in the rules, non-counseling related fields include, sociology, education, theology. So if
That's an
this,
LPC rule?
it's an LPC rule. So obviously this isn't LPC, but to draw the comparison, if staff were to receive a theology degree, they would say it's not a related field if they were applying for LPC. And so that's sort of the logical leap that they look at and say, well, then if it's not, now, again, it's not the same rules. I'm just saying that's the mindset that
Well,
staff is using.
But one of the roots of our license is in theology. When you look at like the history of the MFT as a field, we have, all of our anthropologists and biologists and psychiatrists and psychologists who form one vein, but there's another vein that comes through pastoral care and counseling, through pastors and ministers trying to figure out how to minister to families. And that's how my degree is actually, my program at Abilene Christian University, we're in the College of Biblical Studies, and that's the reason why, is because of those roots in theology. So I don't know, to me, a degree, an MDiv with that specialization in pastoral care and counseling, again, to me, that would be a related degree, but
Here's the MFT rules.
While we're looking at that, have we approved equivalent degrees before? And if so, what were those? What are some of the equivalent degrees that we've approved?
Social work, psychology.
Counseling.
Yeah, something that just says counseling rather than marriage. and
But that's not a
family therapy.
defined list. It's not a defined list that says 1, 2, 3, 4, and these are the 4 that are.
It's
applicable.
not an exhaustive list,
Okay.
no. It's just examples.
So that tells me you're leaving it to the discretion of this board to determine whether it's applicable.
Yes,
yes,
y'all,
yes.
and if y'all want to, for just this applicant, or just generally to Dr. Merchant's point, tell us as staff, for MFT, because of the historical reasons, a theology degree is a related degree, we will take that moving forward, and all applicants with theology degrees, we will look to.
you probably don't get very many.
Well, this could be a floodgate thing. This could be I'm against this, and I'll tell you why, because, LMFT is a licensed, government regulated entity. Pastoral counseling is not. There's not a regulation. Anybody can be a pastor. It's a certification, it's a degree that you get, but there's no regulatory board over it. I'll go back to mine. It's like life coaching. At some level, it's not a regulated industry. Albeit it does great work, it's needed, it's there for a reason. People can learn solution-focused therapy techniques and practice solution-focused therapy techniques and not be licensed. That's kind of what is taught in pastoral care, are counseling strategies and techniques that are not limited to what we do, but licensed by the state of Texas, are held to a certain standard to demonstrate skill set and educational criteria, practicum experience within so many hours that demonstrates that you have attained that level of knowledge and clinical expertise and skills. Pastoral counseling, chaplaincy, life coaching, they are not regulated fields, even though they use many of the same strategies that we can use, which is why I think the line between these are going to continue to be challenged unless we take draw a more clear line. He's got 27 hours in a COAMFTE program under the old rules, he needs what, 48, 36, 48? 48?
45.
45. If he gets the remaining hours with that, specific for that, I would be open to entertaining that, saying he has met the criteria as licensed, as mentioned in statute for us to consider. But right now, I'm not in favor of it, even though it's amazing, it's great.
But I think we could make those same arguments about psychology and social work, especially because, you know, social workers might get one course and couples therapy, and yet we count them as a degree. You know what I mean? We count their degrees as a related field.
If they demonstrate all of the coursework that meets
Right.
the criteria that we have.
Exactly, and he might be able to do that.
He may be able to, but I didn't see any clinical hours. I didn't see any practical hours.
And he might not have any, but here's, I guess my point
Ew.
though, is we're not determining whether or not he actually meets the if he meets the criteria, we're just determining whether or not he has a degree that qualifies. And so for,
Okay, and I'll go on saying that a theology degree is not going to meet, to me, it does not meet the criteria for a other mental health field.
it's not, you don't see it's related.
And I
Not,
guess,
not for the purpose of the licensure.
I guess I'm not a professional, so from my perspective, I think it does meet, but it's a master's of divinity versus an undergraduate degree in whatever, social work or counseling.
Could be a master's in marriage and
Master.
family therapy.
Okay, so I'm a layman, so I don't know the difference. From my perspective, I would be comfortable with someone with a master's in divinity counseling me as I would as someone with a master's in social work. That's just from a layman's perspective. Now, I also don't agree with comparing it to coaching, life coaching. Life coaching is not coming from an accredited university and a master's degree. Anybody can be a life coach. You don't have to have a degree. You don't have to have any certification. So I can't make the correlation between a life coach and a master's divinity. One is clearly superior from my perspective than the other.
Go ahead.
So I can, in this case, I would probably be in agreement with it, but I wouldn't want to open the floodgates, as you say, and say that every theology degree would qualify. I think we take a look at some of the other coursework he's done, some of the experience he has, when the classwork was done, when he started a degree, to make an exception versus saying this is a blanket statement that we're gonna take a theology degree across the board.
May I ask a follow-up question?
Sure.
So,
Me?
so I think what I'm hearing you say is that his theology degree is not sufficient, that he needed those other courses to supplement, in which case the theology degree by itself is not enough. Is that what I'm hearing? you
Yeah, I
say?
think the totality of
Okay.
what I'm hearing.
So those are two different, because I think what I'm hearing Dr. Barti say is theology degree is not enough. What I'm hearing you say is the theology degree is not enough. However, when you add the other stuff together, that
That makes me comfortable.
so the two different like points to make.
And what I'm saying is I think a theology degree with an emphasis in pastoral care and counseling is a sufficient degree. That doesn't mean they have a sufficient coursework. It just means that they have a qualifying degree
To be considered.
to be considered.
Did you find this transcript to be an emphasis in pastoral care and counseling as opposed to theology?
Some of it looked like it was, but again, I've not looked at enough transcripts in pastoral care and counseling. So, but here's the thing, we don't ever look at transcripts. We always look at what is their degree in. You know, like, I don't know. I mean, you wouldn't go, is this social worky enough? Or is this MFT, is this social work degree MFT enough? You would just go, oh, it's a degree in social work. And so MDiv with that specialization in pastoral care and counseling. Again, to me, that would be a related field. But I could be the minority on the board and we decide by voting. And so my alone opinion might not be enough to sway. And that's okay, because we get to make this decision as a group.
And we're only making a decision about this case.
About this case.
That's correct. This case is this degree equivalent to move on to the next step. That's the only thing we're deciding, correct?
Right.
Correct.
Okay.
Did you have an opinion?
I did, and I mean, based on what you were saying in your follow-up question, and then what Dr. Barti was originally stating, there's the similarities, but again, the root, I won't say issue or question at hand is the regulation. between theology and, what an MFT has to do. But again, it's gonna go back down to this case in particular and the totality of it. But I mean, I won't say it's apples and oranges, it's apples and pears. It's close, but it's, it's not there. So, but I agree, that the best way would be to take it to a vote.
Let's be really clear on what we're voting on now.
I know,
Yes.
but first I want to hear from Elvira, Barbie, either of you have anything you want to add?
I'm just wondering why he wants to be regulated.
Oh, yeah. Why not
That's
just
a
do
good
pastoral,
question.
why not just keep doing pastoral
Yes,
counseling?
Got his
and-
hand up.
What?
Are you able to hear me?
Oh, Mr. Jones?
Okay,
Why-
can you hear me? I think I have to be unmuted.
Yes,
Can you hear
we
me?
can hear you.
Okay,
So the
good, good, good.
question is why
Right.
do you want to be regulated?
Okay, for the reasons that you guys are disagreeing, just to be honest with you, if I can just be totally transparent. I believe that pursuing licensure gives me a different type of authenticity. Not all MDivs are the same. I also have a concern about this being a floodgate. This is why I think this situation is being handled the proper way. So this allows for it to come before a board and you can look at the degree and you can see, do I have enough to be a related program? I agree. I think that I do. In addition to that, you can also require additional coursework of me as well as other candidates. And so that still gives you the ability to safeguard the well-being of clients that are coming to an unsuspected person that they don't really know, hoping that they help them. It gives you that ability. And additionally, the reason why I desire to be regulated is I have learned that I'm actually extremely effective at working at couples who are at and near divorce. But in order to make a living, I'm charging a certain amount, and a lot of people cannot afford that amount. So I'm at least hoping that they can get reimbursement. I technically am doing quite well financially, and I do not advertise to get clients, but I really specialize with people who are at or near divorce, and the majority of them are African American couples, and I have a pretty thick wait list. But they can't afford me. But by becoming licensed, I'm basically trying to state, listen, there are a lot of people going to programs that are questionable. They don't have the same training or credentials that I do. If you're also concerned about my ability to do the job, I will have a supervisor and I will also have to pass a jurisprudence exam. If I can't do those things, then I can't do them. I was not prepared. I would have to pick up additional work. But what I'm stating is that there are some schools that are rigorous enough. There are some pastoral counselors who are near retirement who are trying to state that the standard of pastoral counselors should be that of a marriage and family therapist. And they were doing this 20 years ago when many pastors didn't really counsel outside of the local church. But now it's a full-fledged field to where people are going to seminaries to become counselors and they're working like a LPC or a MFT. So I think this is a great opportunity for the board to state if we're going to have people that are doing a related field, I think it's fair. Social workers that I know have taken 9 hours in marriage and family therapy, but it's a related field. I've given you my Princeton degree, which gives you at least 36 direct hours, plus an additional 36 hours from Turo. When it comes to coursework and the ability, I'm definitely there. But I'm also attempting to establish a precedent by saying if we're not currently recognized because there are too many varied MDiv programs, then let it come to the committee and you guys can look and decide. But I'm really asking for us not out of trepidation or fear that it opens a floodgate to take an application and a resume that really should communicate this guy is thoroughly prepared and put me through additional steps. Just I hope that you can see that this is relevant, but it also is going to open another question that y'all can arbitrate individually. And I don't know if there are going to be a lot, but I think my credentials suggest that this is a related program. Last, and I know I'm long-winded, but you're talking to a preacher. I apologize for that. Theology is an umbrella term. When many people think of theology, they think of Bible study only, but actually there is a theological field for just about everything from anthropology to social work to marriage and family therapy. What theology is asking is how does God relate to this particular problem? And so when it comes to theology as it relates to pastoral care and counseling, we're asking what message does God have to couples as well as persons who are suffering to help them get through their current situation. So it's a really specialized way of working with a certain population. But theology is extremely broad. It's just a way of saying we're going to ask the faith question alongside the traditional discipline question. Thank you.
Mr. Jones, I have a couple of questions. I'm sorry, sir, you're providing pastoral counseling now,
Yes.
and you treat couples?
Yes.
And what religious organization is overseeing your work?
The church that I pastor is called Restoring Hope Fellowship. And so persons come to our church if they, generally speaking, will have 1 to 2 sessions. And if they want something more clinical, then I work with them directly.
Okay, so like you pastor the church and you provide pastoral counseling through your church.
Correct.
Okay.
Are you ordained through through a denomination?
Yes, I've been ordained for 26 years.
And what was the organization?
There are 2, the Missionary Baptist Association and the Progressive National Baptist Association. And I also have a recognition by the Texas Baptist, formerly known as the Baptist General Convention of Texas.
Thank you.
Could I ask a
And
follow-up question? Oh.
yes.
Um,
And so as clergy, we're kind of exempt. So we're still able to function as therapists. We're just not allowed to identify as marriage and family therapists.
And Mr. Jones, could you tell us more about your decision to discontinue the master's degree from the COAMPT program? It looked like you were really close.
Yes, it's somewhat financial. It's also principle, but it's not the most effective use of my time. I'm finding that the coursework I've already covered, yes, I'm relearning certain names and certain theorists, but this is material I covered during my Master's of Divinity. And so I don't have the time because I'm only halfway done. So it'll take me another 2 years. And that's costing me financially, and it's also costing me a burden. But the principal matter is I feel like I'm having to double do things. And I have a skill set that some MFTs simply don't have. And I'm also taking the same coursework that they're required to take as well. So I'm just making an appeal for fairness because I think this is a matter of an oversight.
As a board member who's married to a priest and who has an MDiv, he and I have a deal. Dude, your degree did not prepare you to do therapy. If you do a couple sessions and they need more, you refer to somebody else, me or whoever else, but you're not qualified to be a therapist. And he's like, I absolutely agree. I wasn't trained to do that. So I'm on the side of Dr. Barti, where I do not think that I would feel comfortable moving forward saying that MDiv is a related degree. I think, Mr. Jones, you are a unicorn in that you are incredibly trained and incredibly skilled, but I just have so many reservations about that MDiv being considered a related degree. So my preference would be that we move forward with asking Mr. Jones to get the coursework he needs in order to have a degree that qualifies under our rule.
Is that a motion, Jody?
Sure, I'll make that motion.
Oh, wait.
No, I think Dr. Barti has something to say.
Yeah, well, just a clarification. A master's degree that has coursework that meets LMFT criteria, I'm okay with. Does that make sense? So, does Mr. Jones, does he meet the course requirements? Or how,
We haven't analyzed it.
We didn't analyze,
didn't even go that
we
far?
didn't go that granular.
And,
Okay,
and y'all get to decide what we do, but the reason we don't do that is just for this kind of situation with Mr. Jones where someone, I won't say divinity, let's pick a different, but
accounting.
something that even,
Social one?
social work, let's say social work, or humanistic studies, there we go. Humanistic studies is not one that we would normally count. And the reason we don't just immediately look at the coursework is that what I suspect would happen in this case is we would say, okay, the underlying degree that we are saying is the foundation for you getting this license. Humanistic studies, we're gonna count 2 courses out of that transcript as meeting the rest, as falling on the list. And all the other courses you bring in from some other university programs that you added later. You as the board can tell us, that is fine, that's what we want you to do, but that is different than what y'all have set up till now. Your rules say that you need to have an underlying degree that it itself is fundamentally meant to train you to do this. And the Frankensteining, if you will, has up till now been, oh, but you're missing 1, 2, 3 courses on this list that we require. Go and get those elsewhere and bring them. We have not allowed someone to bring in the majority of the MFT coursework from some other source and rely on, for lack of a better term, a shell degree to count.
So I think
And
that,
you can tell us.
yeah, I think that would be my only concern would be that we have rules and things that we're following for everyone else. Like you said, opening Pandora's box, but I think we need to maintain the ability to be objective, and we have a very certain criteria that has to be followed. I just want to make sure that we're being objective and fair.
But that tells me we have a finite list of degrees that we consider acceptable. So if we don't have a finite list, then it's subjective. So what's the finite list? So because if there's not a finite list, then every time somebody comes here, they're wasting their time. Because there's no precedent to allow anything other than 1, 2, 3, 4, and 5. If we're not gonna look at the underlying coursework of those degrees, because a master in Div, and MDiv is different at Princeton, at UT, at LSU, at Michigan. So if we don't look at the underlying coursework, how do we make that determination?
Part of the problem in creating a finite list in degrees is they change. These things adapt and evolve, and you may get this unique twist that you'll see one type of humanistic degree now, 2 years from now, it'll be something else because that one will fell out of favor for whatever reason. So we can't really create that list. This is about the best methodology for determining what is a related degree is to just bring it before y'all, lay it at your feet, and you're gonna have to decide. I don't know a better way to do it.
And so that tells me though, that an MDiv 20 years ago could be very different than an MDiv today.
Yes.
And so if you don't look at the underlying coursework, how do you know that?
To help you, for the board's consideration, sorry if I interrupted. I'm pulling up an email exchange that staff had with Mr. Jones. And our staff looked at the course catalog that was applicable to Mr. Jones' transcript. And she quoted the Master of Divinity program was designed to prepare students for parish ministry, for graduate study in theology and related disciplines, for chaplaincy, for mission work at home and abroad. And staff concluded that that did not describe a degree that was designed to prepare someone for marriage and family therapy.
Okay, so that's the high level objective. That's not the detailed coursework.
That's just the overall program objective that staff found in the course catalog.
Elvira?
Oh, I was gonna ask, Madam Chair, what your motion would be, if you had one.
Oh, well, it would maybe be different from everybody else's, but that's okay.
But I wanna hear it.
Oh, okay. I would probably make a motion, I don't know, to accept this as a related degree. But I think Jody's motion is on the floor right now. Assuming that we have, do motions die? Like she kind of made the motion.
It hadn't been
seconded.
seconded.
It needs to be second.
It hasn't been seconded.
So I would have a motion on the floor to send this back. I know I'm gonna be hated for this. Send this back to staff to get an assessment of the underlying coursework to determine whether it's truly equivalent.
Okay.
Functionally,
Okay.
that is the same motion.
Yeah.
Because if we're gonna do the review of coursework, we're gonna let.
We gotta prove that first before you do that.
Okay,
Okay.
and let's, go back to this, because 801.113B. An applicant for an LMFT associate or LMFT must have a master's doctorate degree in marriage and family therapy or a master's or doctorate degree in a related mental health field with coursework and training determined by the council to be substantially equivalent to a graduate degree in marriage and family therapy from a regionally accredited institution or higher institution.
Does social work qualify?
Yeah, it's listed as a.
Yes.
As a related.
It's-
But inherently, a Master of Divinity is not inherently a master's in marriage and family therapy.
But neither is
It's-
social work, if you ask me.
Well,
It is by virtue of it being in rule right now.
but yeah.
Robert?
So I will say, I am hearing that the board probably does not want to make this case a rule for all time going forward.
Right.
And that is fine. We have a remediation rules for reasons. We have, right, so I think we can take loud and clear that we as staff will not read into this one how you want things to go forward. And I've already got ideas for rule changes we might need to address.
Probably.
So,
Thank you, Mr. Jones.
Hey, this is great. Nerve wracking,
So-
but great.
Certainly, make your decision based on whether or not you believe the training and qualifications Mr. Jones has meaningfully puts him on a path to meet the qualifications you require for this education.
So that would include him taking some extra courses.
Just,
That is
just
something
whether
we
has started down the path. If he
So-
has started down to the correct path, we're still gonna make him, because I will again say, we've looked over the transcript some. We've not done a deep dive.
Okay.
He says women, and I don't have that one up anymore. Women in something meets one of our requirements. We're gonna independently review that and make sure. And I'm pretty sure most of his divinity degree will not count toward the coursework requirement.
Do we have I only see one transcript in the folder, but maybe I'm missing it.
Which one are you looking
The one we're debating over, the Princeton.
at? It's the 5th from the bottom.
Is the fifth on the bottom? Oh my gosh, okay.
There was a lot of.
It's a
He
lot of
provided-
stuff.
So while the board's considering, would the attorneys look at the statute? I've put it up, because the board can waive certain things, but they can't waive statute.
Yeah,
So we have, what you're saying is we have to have a related degree. He doesn't have an MFT degree, so we have to have a related degree. That cannot be waived.
That's what I'm asking.
Yeah.
I'm
No,
not-
that's right.
You're right. And it does specifically, unlike, maybe one of the unique things here, counseling staff are a little bit more free to accept because it just says counseling related and full stop. They can interpret. This does say a related mental health field with coursework and training determined by the council or the board in this case to be substantially equivalent to a graduate degree in marriage and family therapy.
So you can only look at the Princeton transcript, at the Princeton degree, to determine if it's
A qualifying.
a
degree.
qualifying degree. He's
Yeah.
highly educated, he's highly qualified,
But the question.
but
is
according to
about
statute,
degree.
This
you get to look
degree
at the
is
degree.
based- Okay. And then we have the transcript in front of us, and, that's why I think I think it's enough to go back to Jody's original, motion. And Jody, could you repeat your motion again?
Sure, I'll do my best. I make a motion that we determine that the MDiv from Princeton is not a related marriage and family therapy degree, and that we encourage Mr. Jones to finish his degree from the COAMFT accredited program that would yield a degree in marriage and family therapy.
I would second that. Any further discussion? I'm sorry, I'm reading. I mean, it looks like probably based on the other form that he provided us, like the written out what classes he's had. It looks like only 4 of the classes would actually come from the Princeton degree. Like 4 of the list. Okay, are we ready to vote? Okay, all those in favor,
Can you restate that?
so her motion is that we deny that his degree from Princeton is a qualifying degree.
Is that the only motion we're gonna have on the floor?
Right now, yes, yeah.
So a vote yes
If you
is to
think,
deny the appeal so that he does not get a license.
correct.
A vote no is to send it back to staff for further review.
Thank you for the clarity.
And if we deny the license, he still has the ability to finish his co-AMT degree and still come back. So we're not suggesting at all that he can't become an MFT. We're saying that based solely on what he currently has today, this hot minute, that we need more. That's all.
Deficiencies.
Yes.
But this vote does set a precedent for future.
Robert, I
Yes.
think you promised us that it does.
If the vote is deny, then I think it sets a precedent that anything else that comes here, it may not be a finite list, but there's a pretty concrete list of things we'll accept as an equivalent.
Back to
degree.
the list.
I will bring you back rule language to clear this up.
It will start operating like case law
There.
after a while.
Well, I think the
We
one
will
thing
not.
is that the transcript was provided. And then that's, I wanna say. That, and it's not the totality, but it's the majority, I wanna say, at least for me, enough to make a decision. Just based on, and I mean, it's pretty clear on what these courses were.
But are we denying based on the transcript, or are we denying based on the underlying degree?
Yes.
The transcript is, I wanna say, is his degree. It's telling me what his degree is. So I know we had the synopsis earlier that was shown from there, but this is saying, I did this exactly. So therefore, it's helping with the precedent moving forward. His exact transcript says, I did this. If this was an art degree, I took 1 art class, 1 hour of art out of 40 hours. That's what my transcript says. So that's why I would say it's not opening the floodgates in particular, because I'm looking at this transcript for this gentleman only. So therefore, I'm not applying it to anyone else. That's where, if you will, I'm basing my whatever I decided in my vote based on this one transcript for Mr. Jones.
So if another transcript comes that says MDiv, you reevaluate that.
I will look at it, and again, because they will look at it and say, not really, and recommend yes or no. But we'll see it and we'll say, like you said, it varies. That's the one thing about MDiv. And well, he has 36 hours. So I say yes. But again, that's where, again, looking at, if we didn't have this transcript, I probably would just be like, my motion would be to, get the transcript and go in finite detail. But having the transcript, it's telling me
I mean,
information.
I'll be honest, having the transcript actually makes me more on the fence than I was a minute ago, because it looks like there's only 4 classes that would come from that transcript.
And please do understand, I want to defend staff a little because maybe I haven't represented well. They have read all of this.
Yeah,
We
yeah.
do not get the transcript and say, it's a Master of Divinity. No, I'm not looking any further. I won't look. We do the work to make sure, okay, this doesn't seem like a related degree. We haven't used this before. We're pretty sure it's not, but give us your transcript, give us the course description, all the materials you have in your folder, our staff reviewed and looked at. And so what we didn't do is go through each of the required elements and say, here are the 10 hours of coursework you're missing. Because that's more of a go make that up. We will never just dismiss somebody out of hand. We will always look deeper to make sure, but we won't bend over backwards for folks who don't have what seems to be a required degree.
Okay, so are we ready to vote?
So you have not really dived deep enough into his materials.
That's
No,
not
we-
true.
no, no,
They have
Not
done-
true.
they haven't done a,
We haven't done a written analysis of each academic requirement. And that in part is because, Mr. Jones, has not yet shown that he's passed the AMFTRB exam, which is an expensive and time-consuming exam. So rather than have him fill all the requirements for every element of the application, before we came to you with, is this even possible? We wanted to come to you and get your decision first. Because otherwise, we're sending Mr. Jones to spend hundreds of dollars and maybe lots of time to get all of those other requirements and ducks in a row.
okay, let's, the motion is on the floor, to deny, that this degree is a related degree. So all those in favor of denying that this is a related degree, raise your hand. 1, 2, 3, 4, 5, 6. Okay, all those who
Would approve.
Oppose the motion.
would oppose this motion, raise your hand. All those who are really still undecided and are just going to abstain. Anyways, okay, so motion passes. So in other words, Mr. Jones, we at the board have voted and we are denying that your Master's of Divinity is a required degree, or is a related degree, and such. If you do decide, you will need to finish your degree at Touro University if you decide you want to become a marriage and family therapist.
Are you able to hear me?
Finish the hour.
Yes.
Finish the hours.
Well, okay, well, you're able to hear me?
Yes.
Yes.
Okay, all right. Thank you for the consideration. Just one
You're welcome.
response.
Mr. Jones, I'll follow up with an email so you'll have in writing what transpired today.
Yes, I do just have one question for clarity. I just want to make sure that you're aware of one thing I stated was the 12-month.
You're breaking up?
One thing I stated was the 12-month residency, which was a clinical residency to where we counseled for 20 to 30 hours a week under direct supervision. So I'm only stating that to you, Jody. That is clinical. And so when you have a pastoral counseling focus, you go to clinical pastoral education. And they called it clinical for that reason. And your expectation was to work as a professional social worker for some, counselor for others, and some chose to go back to graduate school to get a PhD in psychology. But it was clinical. But I do respect your vote, and I thank you guys at least for the opportunity.
Thank you so much.
Thank you,
for
Mr.
being
Jones.
here.
Can I change my vote?
Sure. Anyway, okay, we need to take a break. So can we take a 10-minute break? Y'all go to the 10-minute break? Okay, let's do that. 10-minute break. Adjourn. I didn't hit it.
No.
No,
Hold
you're
on.
good.
Not adjourned.
Oh, not adjourn,
10-minute
recess.
10-minute recess.
10-minute recess. We're in recess.
Meeting's over, everybody go. Dr. Elder, can you hear us?
No.
Yep, I'm here. All is well.
Okay. Hello. Okay. Then we are adjourned.
No.
We are
Reconvene.
reconvened.
Recommitted,
Free something.
press free.
You ever heard that leg?
No such thing.
We're back.
We're back.
Yeah.
Okay, we are back and we are now moving on to agenda item number 7. Oh, no, we did number 7.
We did them.
Okay, so we're moving on to number 8, enforcement matters. Let's see here. I don't think we have anything here, do we? We don't have anything for 8 or I'm sorry, for 8 for.
Unless you have questions about the reports
Any-
regarding agreed orders or cases dismissed by the council's director.
We could hear whatever you were shuffling, Jody. We just heard you shuffling something.
Oh, sorry.
Okay, then moving on to agenda item number 9, rulemaking. We have a couple of we just have one rule up for adoption. This is 801.261. This is requirements for continuing education. Essentially changing the rule to, well, you have a copy of the rule in front of you. So, do we have any discussion?
This is Jody. Oh, go ahead in the room first and let me know when you're done.
Oh, I was just gonna report to the board that y'all have the public comments that we received. There were several. And of course, in addition to the ones y'all previously received about proposing the rule. I will note for the board's consideration that the Psychology Board met earlier today and voted to adopt the change. Certainly happy to give another round of explanation of what the change is meant to do or not meant to do, and how we will approach it going forward. But we have talked about it a lot, so I'll defer and of course let y'all discuss, but I'm happy to provide more if y'all need it.
Would the board like more explanation from Robert, or no good, or what would you like?
I don't know if the board needs it. Would it be, since we've got the public comment, would it be appropriate to kind of just
Go for it,
review?
Robert.
Sure. So I essentially what I would say is that we staff, the board, all the boards, the council, we recognize this is a fraught topic, and we don't enter into this lightly. One of the commenters who came to the Psychology Board and many of the online written comments you got talked about the idea of caving to political pressures and are taking a side in this fight. And what I would say is we are proposing this change neither to agree with or engage in a political battle over this content. We are instead doing so to preserve the underlying requirements to ensure that licensees have meaningful education to provide competent service to the populations that they are serving. And that the desire is to avoid any distractions or political distractions over what words like diversity mean, when the focus here has been and will always be that Texas has a wide variety of people who need mental health services, and providers need to be competent to provide that service both to the population they intend to serve and the population that walks in the door when they don't anticipate. And so we feel like the use of the words that we have proposed communicates that and gets us out of being a target for a political distraction that is not about what we're about. So that, for what that's worth.
Great, thank you, Robert. Okay, Jody?
Sure. I just want to be transparent. This has been an incredibly, as I'm sure for all of you, but incredibly difficult rule change. I'm going to vote in favor of it because I do believe it preserves the spirit of the original rule, which was not only do we as clinicians have to know how to provide treatment, we have to know about the people to whom we are providing treatment. And I want to say just a a ton of thank yous to our board attorneys for their acumen in the development of this revision, because you are splitting a very fine hair and walking a very fine line, and you've done it beautifully. I think it's imperative that we as clinicians understand the context in which our clients live. We hold the power in the room. Therefore, we hold the burden of knowing about our clients. We don't have the luxury of being colorblind or race blind or age blind or culture blind or gender identity, sexual, all those words we had to take out. We don't have the ability to be blind to those things, because in doing so, we ignore critical aspects of our clients that help us develop a treatment plan that's effective for them. So I really think it is our duty as clinicians to protect the client by knowing about them. It's our job as a board to protect the citizens of Texas, which I think in a broad sense, this rule does, because we're requiring people to know about the clients they serve. And I just implore licensees to keep that in mind when they're selecting topics to meet this requirement. Because I just fear that we're going to do more harm than good if we begin to think we have the liberty to ignore those things. Our clients need us to use our power and our privilege to protect them, and part of that is the CE requirement. So thanks for listening.
Thank you very much, Jody. Okay, any other further discussion? Then may I have a motion?
I'll make a motion, we adopt the language as presented.
Second. Okay, any further discussion?
It was Ms. Rainier who seconded?
Yes, ma'am.
Thank you.
All those in favor of this rule change, raise your hand. And that is unanimous. Okay, moving on to proposed rules. We have 3 proposed rules to bring before you. The first is 801.44 relationship with clients. This comes to us from BPEC, and it is an attempt to just standardize requirements across the board. And hang on, I'm going to pull it up so I can have the actual language. Oh, you have it.
And this actually, the main
it's
change
further
is
down.
further down.
Yeah.
This came from the rule review process. We had a commenter who noted that the rules for engaging with fellow providers when there's one client being treated by multiple providers was not really aligned between the 4 boards, meaning that some providers had a ethical obligation to work with providers who did not have an obligation to work back. And so this is an attempt to use identical language across the boards to make sure you are informing licensees when you are working with someone they're treating and having a collaborative relationship.
I do believe one of the things that came up in the rules committee meeting also was that sometimes like maybe a psychologist who had like a higher standard to collaborate would reach out to an MFT, and the MFT would be like, I don't have to collaborate with you. And so like the psychologist has this role that he's supposed to collaborate, but he's trying to work with somebody. Does that make sense? And so it just kind of standardizes it across all professions. So any discussion? Okay. You say it loud enough?
I like it.
I make a motion, we accept this rule.
I second.
Okay. Any further discussion? Okay, all those in favor of accepting this proposed rule, raise your hand. And that is unanimous. You did raise your hand, right?
I did.
Okay. Okay, the next rule, I gotta go back to the notes. 801.142 regarding supervised clinical experience. Most of these changes are relatively minor, but here we basically want associates to be transparent about any remediation plans they've had. We've heard complaints or concerns about associates who will get a remediation plan from their supervisor and then they just change supervisors. And then don't tell their new supervisor about this remediation plan that their old supervisor created for them. And so this is, again, just a way to kind of help just kind of increasing that transparency about remediation. Any questions, comments, discussion, anything the attorneys want to add?
It also ensures that when you change a supervisor, you need to let us know. And if an associate gets a complaint against them, they need to let the supervisor know, because the supervisor might also have liability as the supervisor.
I have a question about number 10 and how you enforce that.
It would be complaint based.
Yeah.
And so, like most of our violations, if a supervisor, probably what would happen is a supervisor would find out that their supervisee had not provided the remediation plan to them, probably end their supervisory relationship and then file a complaint with us.
Thank you.
Any further discussion?
Just one comment. Wouldn't it be fun if an associate that's under a remediation plan changes supervisors, that somehow the supervisors are required to have a conversation as part of that handoff? Just to make sure that this is a cleaner handoff as opposed to a troubled handoff?
Well, we're kind of getting at that in the next rule change.
Thank you.
So we'll get there in a second.
Cool.
Kind of professor leads off with, wouldn't it be fun?
Yeah, my kids always hated that too. Forget the professor thing.
Okay, so any other discussion regarding this proposed rule? I have a motion then?
Motion to approve?
Second.
Any other discussion? All those in favor of these changes to 801.142, raise your hand. Okay, that's unanimous. Okay, then we'll move on to 801.143. And so this kind of goes to what you had just mentioned, Russ, or Dr. Barty. This allows for the enables the sharing of the remediation plan with subsequent supervisors. So that if you are supervising someone, you give them a remediation plan and they jump ship and go find another supervisor, it enables that supervisor, the old supervisor, to give the new supervisor a copy of that remediation plan. Yes.
Okay, point of discussion.
Mhm.
The word says may.
Right.
I would like to recommend that word be must
Shall.
or shall, making it something that's less optional.
I don't know how I feel about that. I don't know.
The reason that we used may instead of shall, it's your choice, was that would require then making sure that the supervisors have each other's contact information. And there are certainly times where someone will be moving across the state, or they are taking a break in supervision where they may not have another supervisor lined up, but that it is less assured that that handoff will be able to be managed. And putting a must or shall means that they must make sure that information happens and that contact happens. Practically speaking, we felt like that was a bridge too far.
Would supervisor 2 be required to enforce the remediation plan?
No.
So if supervisor 1, if associate leads supervisor 1 with a remediation plan that is not completed and they change supervisors and supervisor 2 is not aware of the remediation plan, then when the forms are turned in from supervisor 1 and 2, 1 is going to say, yes, a remediation plan, here's what it was, because that has to be submitted, correct? With the attestation.
With reservations, yeah.
Right, and that's supervisor 1. Supervisor 2 is clueless about all that. And that's okay?
And then
So-
staff would ask more questions,
Because they didn't
Then
follow
staff-
up.
Right.
because now there's a rule that says.
Okay, then would supervisor two be dinged in any way for not following up the remediation plan that they did not?
The associate is responsible for sharing the remediation plan with the second supervisor. It's difficult to hold a supervisor accountable to what they don't know.
Right. But I mean.
And when we get those instances, we as staff do look deeper into the details. So if, for example, supervisor one spent 2 months with the associate and was just developing the first remediation plan, and then supervisor two spent 24 months with the associate, and the supervisor two does not have any sort of remediation plan, we probably won't consider that to be a problem, because at the very beginning, associates are going to have more remediation needed. And if that supervisor then went 2 years with the associate and is not reporting any sort of problems, we would not find that shocking. If the reverse is true, if the first supervisor spends 20 months with the associate and ends with a remediation plan, you're not close to being able to be independent, and they jump ship and go to another supervisor two for 4 months, and there's no record of the remediation plan or any concerns, we are going to be following up with supervisor two to say, hey, what can you tell us about this particular area? This person did not seem like they were ready. Did you look at this at all? Did you, and if in that instance, that supervisor says, oh, yes, they told me about that and we worked on it, great. If that supervisor says, oh, well, that was a problem with client intake and we don't do that, or whatever it is, that's, my associate never had to deal with that, then that's gonna be a problem. So we weigh all of those factors when that comes in.
Okay.
And I think the purpose of making it a may is the reason why that was added is because there's a requirement that the supervisee give it to the next supervisor. But they didn't want to they wanted to make it clear that it was fine for the old supervisor to talk to the new supervisor and to say, hey, here's the plan. And it's clearly allowed, where if that wasn't added, the supervisee would say, why are you talking to my new supervisor? We're done. Don't, then there'd be some sort of conflict between those two. It was more just you're clearly allowed to do this, as opposed to if you make it a shall, then it makes it a potential violation, and now we're disciplining supervisors for things where they're having to hunt down old supervisees and find out who their new supervisor is.
Thank you. That works.
Are the other boards doing this as well?
Not at the sharing, putting the burden on the associate, yes. This was extra language requested by your rules committee.
Got it, thank you.
I have another question just about this, about this entire chapter. I thought we also discussed in the rules committee for M, like M3, doing away with all of the 3 hours for defining, 3 hours for this. I thought we had talked about stripping all that.
We talked about that, and because everyone's 40-hour course requirement is generally similar, what was
We
settled
decided-
on was to
Give you
leave,
instruction.
leave the numbers in there as a guidance for people constructing a 40-hour course,
That's right.
but we will not check
Okay.
their minutes.
Okay, that's right. I remember that now. Thank you. Okay. Any further discussion about this? Okay, do I have a motion?
Motion that we accept this rule.
Okay, do I have a second? I will second that motion. Any further discussion? Okay, all those in favor of making these changes to 801.143, raise your hand. Okay, motion passes.
Now, the next step, these go to
Go to BHAG,
BHEC, and BHEC is meeting when?
June 24th.
June. And so then if they approve,
They'll be published in the Texas Register with a 30-day public comment period. And then they will come back to the board, which wouldn't have been in time for the July
Right.
18th meeting, but would be in time for your September meeting, most likely, unless something really untoward happens.
thank you. I just know the calendar is getting a little weird here with the summer and everything. So, thank you.
okay, then moving on to, the item number C. Discussion and possible action concerning the petition for rulemaking, by, Tommy, Yamamoto. I don't know if I pronounced that right. I'm sorry, sir. Basically, I hope that you have, hopefully you've read that, but essentially he is asking us, consider a rule that would allow us to count the hours acquired in a master's program outside of an internship, kind of in those breaks between between December and January, like between that break, or also perhaps in a break if they don't have a summer internship, but they're continuing at their internship sites. And so he has asked that we consider allowing those hours to count. I have thoughts, but again, I want to open the floor to anybody else who has thoughts. Yes, Ms. Richardson.
I have thoughts as well. I was kind of wondering why this isn't a university issue. Because if the university is telling us that the semester starts on January 1st and ends on December 31st, that's not really up to us. So I was having a hard time understanding why this is an us issue and not a university issue.
Other thoughts?
I think that's spot on. I mean, this is even pre-licensure. So, yeah.
I had a couple of thoughts. One is the rule that allows students to even count their hours for master's programs is slowly being phased out. But I feel like, one, this is mute to begin with because of that. But also I really agreed with, I believe it was Robert who responded that, if they shouldn't be seeing clients if they're not under supervision. And so, again, I can get if there's maybe a small break, but I know like with COAMFD, we are required to provide ongoing supervision even between semesters. So that to make sure like in those little like semester breaks that our clinicians, our students are still getting supervision. So I'm a little bit kind of, I don't know, put out that KCREP does not make those same requirements. But again, that's not our domain, that is KCREP's domain, or universities, as you pointed out, that's university domains. But I will say that I don't think that students practicing unsupervised for an extended period of time between semesters, and especially between like May and fall, is acceptable, because then they're operating outside of statute.
Agreed.
So I don't know, do we need to send a letter or something to programs and remind them of this? Perhaps, or is there something we need to do, or is me just speaking to our microphone, enough to
Speak into the heavens.
speak into the heavens, I don't know. Thoughts from anyone?
I agree. If they're not being supervised, then
Then
they shouldn't be practicing.
yeah, that's unlicensed practice.
Yes. And I still feel like that goes back to that's a university issue. That's not something that.
Well, and keep in mind, unlicensed practice as opposed to unsupervised practice. Because it's the professors that are supervising their practice. The students themselves are not licensed.
Right, but if they are not in an internship, or if they're not enrolled in a course and they are practicing therapy, then technically that is unlicensed practice. The statute only allows them to practice while they're enrolled in an internship.
In terms of just addressing your question of what could you do or what next step, I would think contacting, if you have any contacts with COAMFD, would be.
It could be KCREP.
Or KCREP.
Yeah. I mean, because COAMFD requires us to provide supervision between semesters.
Oh, okay.
Yeah.
But
I think it's
yes,
I mean, from a KCREP perspective, it's my understanding it's not allowed either. This program is making an exception, and this student just spread some very alarming news that the program probably wouldn't want them to share.
Did the student say what program it was? I don't think I caught that.
I didn't catch it either.
I don't think the school was mentioned.
Okay.
The email address is there.
Oh, was the email address there?
it was HCU.
Yep.
You don't have a paper program.
Texas State.
Did we send them a letter? Robert?
Daryl?
Just send them a link to the.
I'm just a BHEC rep.
I graduated from Texas State. Do y'all want me to back channel a little heads up?
Yeah, do, please back
Okay.
channel. it.
No problem.
Thank you. Okay. Okay, we are skipping agenda item number 10. As I mentioned, I'm not quite ready for you guys. The committee hasn't fully reviewed the results, and so I'm not really ready to bring it to you guys for discussion. I do appreciate Barbie, your comments though on your
Did we
appreciation.
need a
for-
motion and I'm sorry, did we need a motion and a vote on the
Oh, I'm so
petition for
sorry.
rulemaking?
Yamamoto.
Yeah.
It's, yeah, we already essentially denied, but without any objection, I will consider your comments to be declining to take it up.
We are declining to take it up. Thank you. Okay, so moving through item number 10, moving on to item number 11, discussion of possible action regarding the proposed survey of LMFT supervisees. So there are two in your folder, but the supervisor one, I'm not ready for us to review that one either because there still needs to be, I'm still working on it. But where is it? Oh, it's right there. But if y'all have any questions or comments about the supervisee survey, I'd happily take those. Dr. Elder, you provided some comments. One of the comments that you provided that I will respond to is you had mentioned about there's like a 9-point scale, and like at one end is like devastatingly harmful. This is actually a standard measure. So I didn't create it. It's like somebody else's. Does it make sense? And so because it's somebody else's measure, I'm using their measure. Does that make sense? I'm not sure I'm explaining that right.
No, it does. It's like you're adopting their part of their measure, so you have to adopt it in whole using the 9-point Likert response scale. My question then is, why is that only for that question instead of, I'm just wanting to standardize kind of, all the others had a 5-point Likert scale. I didn't understand why this one had a 9-point.
Because I created all the other 5-point ones.
Oh, I like yours better, but okay.
I know, yeah. But for this particular measure, like that had already been created by somebody else, standardized, used throughout the literature, like I'm using that one because it's already created, standardized. There's other studies that use that same exact measure.
Thank you, I appreciate it. And otherwise, I mean, fabulous job. It's a great, very comprehensive survey. Nicely done.
Yeah. So, any questions, comments, things y'all, other changes, anything else? Okay. Then, as I mentioned, we will, hopefully get that out, in June and have results for y'all at our September meeting. Okay, then we are moving on to, recommendations for agenda items for the next meeting. Anybody have anything on their mind? Oh, yeah, sorry.
Just be thinking about new committee assignments.
Yes.
That's what we're doing. So,
Yeah, I'm sorry, I should have mentioned that in my board reports. Now that we're getting 2 new board members, I will be, I'm gonna try not to do too much shuffling, because I like it when y'all have been on a committee for a while. I mean, I think there's pros to getting committee service all over, but sometimes longevity is also important. So I'll try not to shuffle them too much, but
Good.
yeah.
I have a question.
Yes.
Can we make sure for our next agenda that CE broker and the rollout is on there so we can get updates since that's going to go live?
Sure thing.
And then
Anything
one
else?
more question I had. At one point, Dr. Barty mentioned at our previous meeting, potentially doing research.
Was it Dr. Barty who mentioned that, or was it me?
Dr. Barty mentioned doing research on all the CE requirements that other states require so that we could make an informed decision about our CE requirements based on the results of our CE survey, but also what other states are doing. I'm just curious about the status of that research and if there's anything you need from us.
We have a spreadsheet.
Oh, okay, awesome, thanks.
I have a spreadsheet.
I think that was done before you finalized the CE survey.
Yes, yeah, we did that before we finalized the survey. So that way we could, some of the questions were about like, this is what other states require, so what should we require based on other states' requirements?
Okay, great, thanks.
Any other questions, comments, thoughts, future directions of the board? Anything else that y'all would like to see on the agenda? Anything else that needs to be said?
I think we probably ought to do some sort of note for Nicole's spouse so that he knows he's not being shouted at. When she comes home. No, it's just carry over from the.
Also, I forgot that I had said we would do another public comment. So let's see if there's any, because I know that somebody did have their hand raised earlier. So one more public comment, if anybody wants to do it.
There are only 2 people in the
Okay.
online anymore.
One of them is done.
The staff can make
So,
comments.
Ms. Fink, if you want to give a public comment, you're welcome to raise your hand, but no obligation to do so.
Okay, then, hearing none. Anything else before we move on to agenda item, whatever? Agenda item number 14,
Re-adjournment.
the re-adjournment. Yeah, I did accidentally adjourn us earlier, so, okay, well then, hearing no, I have to have a motion. I need a motion.
I mean,
Go ahead.
no, it's your last meeting. You should.
Motion that we adjourn.
I move we re-adjourn.
You move. Okay, then at, all those in favor of adjourning? Okay, then at 3:53, this meeting is officially adjourned.
Yay.